Good morning, everyone, and welcome. My name is Kim Hildred, and I chair the Social Security Advisory Board. Thank you for joining the board for our first virtual forum entitled Representative Payees, Opportunities to Improve Service Delivery. Improving Social Security's Representative Payee program has remained an important policy priority of the board's work. A representative payee is a person or organization appointed by the Social Security Administration to receive the Social Security or supplemental security income benefits for anyone who can't manage or direct the management of their benefits. As our researchers have pointed out in their report, there are currently 6 million representative payees managing benefits for about 8 million beneficiaries. Over half of the beneficiaries with payees are minors, and family members act as payees for 85% of beneficiaries. Representative payees serve our nation's most vulnerable people, ensuring benefits cover basic needs such as food, shelter, and medical care. The SSA processes used to determine if a payee is needed, select a suitable payee, and ensure payees are accountable are extremely important, particularly as the need for payees is projected to grow over coming decades due to the aging of our population. Today's forum will first showcase the independent board commission study entitled Selection Processes for Social Security Administration Representative Payees of Adults. The study's authors are Pam Teester and Laura Sands from the Virginia Tech Center for Gerontology, and Erica Wood, formerly with the American Bar Association Commission on Law and Aging. The board thanks them for their excellent work. For those who have not had a chance to read the report and executive summary are posted on the board's website. The first two panel discussions will cover capability determinations, the selection process, training, oversight, and the need for ongoing research and evaluation. We will then hear a keynote by Judge Karen Booth Glenn on supported decision-making. The final panel will consider the public service implications of a more individualized supported decision-making model and how to get there. Our board members joining us today are Henry Aaron, Jagadish, and Bob Jundeff. I don't have my full screen to see if Nancy is joining us yet. Nancy Altman may be unable, well, she will definitely be unable to join us. I wasn't sure if she's going to be able to join us a little bit this morning, but perhaps not, as she is testifying before the House Committee on Ways and Means Subcommittee on Social Security at a hearing early this afternoon. Moving on to a few logistical issues. We are using the Zoom webinar platform for the event, and the event is being recorded. While we have 3 different panels, we expect there may be overlap between panel discussions. To enhance discussions, panel and board members will have independent control over their microphones. Please make sure your mute button is on when you are not talking. If there is difficulty speaking over one another, panel and board members will be asked to stay on mute and raise his or her hand while on the video, or use the Zoom raise hand function. Time permitting, at the end of each session, we will address audience questions. Please submit questions using the Zoom Q&A function located at the bottom of your screen, or send questions to events@ssab.gov. SSAB staff is monitoring this mailbox and will forward questions to moderators. I want to welcome and thank the panelists, discussants, and technical experts for carving out time from your busy schedules to join us today. We look forward to hearing your insights. I also want to thank board members Henry Aaron and Bob Jundeff, who have worked tirelessly on our representative payee projects, this forum, and who have kindly agreed to moderate the sessions, and our staff who have worked so hard to assemble a remarkable group of presenters and panelists. Thank you too for our attendees at today's forum for your interest in this important topic. And I'd like to close with a special acknowledgement. We especially thank NCSMA, the National Council of Social Security Management Associations, an organization dedicated to improving the management and program administration at Social Security. NCSMA members were instrumental in the success of the research. They welcomed the researchers into their offices, encouraged employees to participate, and distributed a nationwide survey. Their collaboration was critical to the success of this project. Unfortunately, Social Security is unable to participate in today's forum, but their representatives are listening in to our proceedings. We thank NICSMA for agreeing to be available as technical experts in each of our panels. So it's going to be a great day. And with that, I turn it over to Pam, Erica, and Laura for their presentation. Thank you.
Thank you, Kim. We really appreciate that. What a wonderful beginning that sets the tone for today. And thanks to all of you who are in attendance. I also want to thank Conway Grinders. I think you're the one who's driving the slides. And so we'll just say next slide when we get to that place. I could not have worked with a better set of people in Erica Wood and Laura Sands to do this work, and I just want you to know that. What a fabulous, wonderful set of people. So I want to acknowledge them at the get-go. So next slide, please, and we'll progress. So our agenda for this morning and our 50-minute tour of a set of work that really has taken over 2 years to do is that we'll talk about the background, introduction, and methods. We'll then discuss our findings and recommendations, and we will also envision some future directions. And in those ways, I think we can set the tone very well for what will be a wonderful day and an important discussion about a large number of individuals who are beneficiaries and who have representative payees. Next slide, please. So you will see that we timed out, thanks to Laura and Erica, we timed out a discussion that will be pretty short, and we know to be on our phones to make sure, and timers to make sure that we stay within the time frames that we need to be able to do the presentation. And we did a longer version to the executive group of the board yesterday and learned that timing really counts to every minute. So what we'll do is, you can see I'm doing the opening remarks right now, and then Laura will do methods, then we'll move right to Erica, and then we'll have brief questions, probably one following each, because we can talk about these so much the rest of the day. So I just wanted to let you sort of know the game plan. It is football season after all, and so you could see how we'll progress. So I will move on to my opening remarks and introduction so that we can press on. So Conway, next slide, thank you. So of course, I believe all of us here know what a representative payee does, and it is, as Kim said, it really addresses 8 million beneficiaries, 6 million representative payees. 52% of the beneficiaries are payees of minors, but that would make 48% payees of adults. And that is really what we are looking at in this particular work, is payees of adults. So different kinds of payees are appointed, the majority being family members, but also there are institutional representative payees that provide care and treatment, fee-for-service organizational payees that are authorized to collect a fee when they process and take care of services, including the disbursement of the Social Security or SSI payment. And so those are the types that we looked at in this particular work. Next slide, please. Just a little bit more before Laura begins with her discussion, I wanted to say why we picked this and how this sort of came to be. We believed that other groups were looking at other components of the representative payee program, but we believe one important place was the person that got picked. Believing, and I think Hillary Dallin will see this right off, that if the right person got selected, then perhaps there would be fewer problems downstream. There would be better holding of rights. There would be persons who didn't need representative payees at another time, perhaps could not have them, and then they would be able to manage their own funds. All those good things would happen if the right person got selected. So we believed, along with the Social Security Advisory Board advice, that looking at the selection processes were really probably the most important place that we could focus our efforts, and that is exactly what we did. I also wanted to say that we had a number of values that undergirded that undergirded the work that we did, and those included the principles that one could understand of beneficence, doing good for someone, autonomy, that would be self-determination for individuals, justice, that one group would not be treated differently from another, and doing no harm, so that the payee would be the right person. Payees, after all, are fiduciaries who make financial decisions on another, but not just the checks. As anyone would look at the palms to look and see what Social Security does, we know very well that the work that is done has a wide scope for the work of representative payees. So with that introduction, I am going to turn it over to Dr. Laura Sands, who will talk about the methods. So take it away, Laura.
Thank you, Pam. We used a two-phase mixed methods approach. That's a common approach used when conducting exploratory research that is focused on defining issues and areas for process and policy improvement. In phase one, the team conducted face-to-face interviews with Social Security Administration field office employees involved in the payee selection process. The interviews were conducted using a standard qualitative interview guide that included questions related to field office staff practices and factors influencing selection of individuals and organizational payees. The questions were posed to elicit open-ended responses. The interviews took about 40 minutes each. Between February and June 2019, the team conducted face-to-face interviews with 10 members of field office management and 63 field office employees involved in the selection of representative payees. Interviews were conducted in Fairfax, Virginia, Hot Springs, Arizona, Great Falls and Helena, Montana, McMinnville, Tennessee, Vancouver and Longview, Washington, and Glen Burnie, Maryland. The interview data were analyzed using standard qualitative analytic techniques that involved multiple readings of the interviews and coding of themes that emerged from the participants' verbal responses to questions. Once each team member separately generated an initial list of broad conceptual themes from the interviews, the themes were then grouped into preliminary categories. Using an iterative process of constant comparison, the themes were refined. The research team developed multiple survey items for each theme to ensure that the questions robustly measured field office managers' opinions, experiences, and appraisal of office practices associated with each theme. The survey items and response formats were then sent to NICSMA leadership, Social Security Administration board staff, and board members. In accordance with their comments, we refined the survey items across several iterations. This iterative process increased the face and content validity of the items that represented each theme. Beta testing of the survey was conducted with NICSMA leadership. The responses to each item provided the final wording check for each item and its respective response format. After finalizing the survey in September 2019, the president of NICSMA sent an introductory letter to over 3,000 NICSMA members across the country. Completed surveys were returned by 584 members, a 19% response rate, which falls within the expectable range for response rates from web-based surveys that are voluntary. 51% of respondents reported that they were district managers or field office managers. 2/3 of respondents said they had been in their current role for up to 10 years. Half of respondents were from offices with 21 or more members of the Social Security Administration staff. 70% of respondents reported that they worked in offices located in urban and suburban locations. The second phase of analysis was to analyze data from the online surveys. We found no evidence of response bias. We assessed response formats for extreme numbers of respondents reporting at either end of the scale, reporting neutral responses, or missing values toward the end of the survey. All of the questions had sufficient variability in responses. Only 2% of respondents were missing responses to more than 10 questions, and they were not the last 10 questions. So that means that there was no fatigue associated with taking the questionnaire. We did not have an a priori hypothesis, and so thus we did not conduct any statistical hypothesis tests. Instead, we presented descriptive results for each item. Specifically, we described the percent of respondents who endorsed each response option, such as the percent who responded strongly agree, disagree, and strongly disagree. The implications and recommendations of the study are based on data collected from both phase 1 and phase 2 of the study. Thank you, Pam.
Thank you, Laura. And Erica, we'll go to you. Next slide, please.
Next slide. Okay. Thanks, Pam. So here you see the 8 aspects or components of our study. And what we're going to do is kind of take a whirlwind tour and put all of these 8 into the next 40 or 50 minutes. And so I'm going to start that tour with looking at beneficiary financial capability. Next slide, please. Okay, so we're looking at the process by which Social Security determines the financial capability of beneficiaries. And that's the difficult question of whether beneficiaries can manage their own benefits or whether a payee must be appointed. Now, SSA has a presumption, okay, of capability, but if a question arises, staff must investigate the evidence. The SSA staff that we interviewed were very aware of the implications of their decision on the lives of beneficiaries, the loss of rights and independence if a payee is appointed versus the possible mismanagement or loss of funds if a payee is not appointed. Kind of the classic clash of autonomy and protection that Pam talked about earlier. So, okay, I see you've already got this slide up, and the first item here is the availability of payees. So when we began our study, we saw the capability determination process and the payee selection process as 2 separate sequential processes. First, the beneficiary's financial capability is assessed, and then if a payee is determined to be needed, then there's a selection of the most suitable payee. But what we found in a nutshell in the real world was that these 2 functions may, in some cases, actually occur together or at the same time. That is, if there's no suitable payee available, then staff may, out of desperation, declare that, yes, the beneficiary is able to manage funds because there is simply no other option. And we found that both surprising and concerning. Okay, so as to the meeting with the beneficiary, certainly face-to-face staff meetings with beneficiaries is key to the determination of capability, but we found that this doesn't always happen, particularly for beneficiaries who are residents in nursing facilities and similar facilities. In fact, 1/3 of the managers that we surveyed said that their office does not consistently contact beneficiaries in nursing homes, making it difficult to determine capability. So we recommend that staff must have face-to-face meetings with beneficiaries, including beneficiaries in nursing homes and similar facilities. And this could include remote meetings, which certainly the pandemic has made much more doable. And then as to supported decision-making. Certainly, supported decision-making was a key theme throughout our study and will be a key theme today throughout the forum. A quick definition of supported decision-making. Supported decision-making allows individuals to make their own decisions, in this case about benefits, with help from people that they trust and they choose. And it also includes practical, technological, and community support options to maximize decision-making abilities. Now, it's interesting that if you look at the SSA guidance, you look at the POMS, the wording seems to invite supported decision-making. The POMS says that the capability determination should look at whether a person can manage or direct the management of benefits. So the person may be able to make decisions and direct the management of funds, but may need help in understanding choices, implementing decisions, and communicating the decisions. Now, our report recommends ways that SSA could begin to advance the use of supports and supported decision-making, thereby possibly reducing unnecessary appointments while at the same time enhancing autonomy, narrowing the pool of payees while promoting self-determination. That's a tall order, and we'll be talking about it on and off throughout the rest of the day. Next slide. We also looked at two sources of evidence external to SSA that bear on capability. The physician's assessment of medical evidence, which they report in a form called Form 787, and the State Disability Determination Service. And we identified some problems with the flow and usability of this external evidence to SSA. Our interview and survey findings show that the State Disability Determination Service's opinions are often unsupported, unclear, and may unnecessarily raise questions about capability, may even prompt the appointment of more payees than necessary. And then as to the medical assessment, interestingly, our findings showed that there were significant delays or failures of physicians to return the Form 787, the assessment form. And we also found that in practice, these forms often end up to be filled out with the beneficiary's diagnosis, like schizophrenia or dementia, rather than information on the ability to direct the management of benefits. And we recommend that the forms be designed to better highlight the ability to direct the management of funds with support, sort of making them for a more functional determination in practice. And now I think we have left room for possibly one comment or question, and then we'll move
on. One question for you. Form 787 tasks medical professionals to make a judgment about the capability of patients to manage funds. It struck me that that may be a task for which medical professionals are not well trained. I'm not sure who else might be trained better, but I'd appreciate your reactions as to whether there is a need for injecting a more informed evaluation than a medical professional can give of the capability of their patients to manage funds.
Certainly, there's a whole range of clinicians that can add a great deal to that assessment. There are psychologists and there are geriatricians who have studied, in fact, assessment and decision-making abilities and assessments. And in fact, some have even studied financial decision-making ability. And actually, somewhere in our report, we recommended that SSA take a look at that body of literature and fold that in.
All right, that was the one question. So if you will advance the slide, please, Diane, I will move on to the next set. Thank you. So I'm going to talk a little bit about, in my short amount of time, I'm going to talk pretty briefly about casework quality, the things that people have, the things that SSA staff do to make the selection process, and how we began to see things that we could recommend to help them. So we learned that 87% of respondents that when we had our NICSMA survey, indicated that yearly training is is very important or somewhat important. So that's a large group. Odd to say in this particular time when we're all remote, but one of the things that we learned was that adding an in-person component to the training was really important. That over time, they had done a lot of remote training, but so much of it was remote that some of it was piecemeal. And so it was older videos that were shown again. that many of them thought that that made a variance in how the staff were actually performing. Then another piece that we were interested in was case review. And we learned that 55% of respondents indicated that the payee determination is reviewed rarely or never. What a missed opportunity. And if it does occur at all, it's performed by a technical expert or other people. The other important component we learned about was documentation, and that it's moderate or highly variable at about 71% of the time. And that's critical because the person who makes the payee selection determination at one juncture will not necessarily, in fact, often not be the same person who might make another determination later. So staff training becomes really, really important to help make the determination. There are guidelines that SSA has through POMS about selection, and we will talk a little bit more about that later. But very critical is the training and the updating that needs to occur when people do that. So consistent in-service training, we believe. We also thought peer discussions were a wonderful opportunity for staff to talk about decision-making strategies that we would have, and that there should be consistent requirements for documentation so that one person who took the case could pick up from another, and also that would inform the decisions that another person has. In addition to looking at casework quality, we looked at workload, and workload and time pressure seem to be a pretty constant theme for individuals who we listen to and surveyed. And that could adversely affect the investigation of potential payees. It could reduce the time that documentation can occur, and it could just add pressure and cloud decision making. And so one approach, of course, would be to increase the field office staffing level to try to do that. Another solution where it made sense would be to specialize staff so that there are certain people who are exceptionally good at making a rep payee determination, or there could be people in the field who could be resources to help make that decision. And then, but that depended on it depended on the size of the office about the specialization. Then secondly, this will be another theme that you will hear, lots of glitches in the electronic representative payee system, reporting system, that really causes a significant loss of time that is somewhat, that needs some revision and to be brought into the 21st century in a good way, and was really holding folks up in the things that they did. And so this was another important piece that we found that needed to occur. So we believe that staff needed to have time to make this really important decision. We also believe that the specialization of staff could be some pilot project in some places to see how that worked, particularly in large offices. We really will, you'll see this again, but we really believe that some of the technological problems in the electronic representative payee system for which the documentation is housed was really creating a lot of problems and frustration for staff. And then we also believed that a number of staff ought to have resources that were in place to be able to make such decisions with such gravity. So I'm going to stop there, and I will flip over to the other slide. The next slide.
It's not advancing.
That's okay, because you know I covered it. so I jumped over there. It happens. There we go. So we believe that staff should, again, just to capitalize, we talked about need for staffing, specialization, working with the software, and having enough time to make changes in payees when that needed to happen. And the importance was that they had the documentation that was appropriate that helped them do that. Okay, so there I am at my time. I will be happy to take one question.
Chris, if you're trying to speak, you're muted, not coming through.
Chris, could you put it in the chat? Maybe I can see it that way.
Why don't we proceed, and if there's time at the end, we could circle back.
Catch back up. Okay. All right. Then since that brief question can be held and asked again, then Erica, I'm going to go back to you for guardians and organizational payees.
Next slide, please. Great, thanks. Guardians, the role of guardians as payees. So guardians are high on the payee preference list because they already have been appointed by the court and they have the court's imprimatur. But not all guardians are high on the list, only those with custody or those who demonstrate strong concern, Now, we know that government reports, including the Governmental Accountability Office, and also media sources over the past 2-3 decades actually, have profiled some sad instances in which guardians take advantage of and exploit those that they are appointed by the court to protect. And maybe you've seen some of those media stories. Yet over 90% of the managers that we surveyed said that guardians are always or sometimes automatically selected as payee. And we think that additional inquiry about guardians is needed, and that SSA could provide more specific guidance to staff on questions for guardians to, so that they can best determine suitability. And then there's the question of coordination of the SSA representative payee programs, a program with state courts that have jurisdiction over adult guardianship. For over 15 years, actually back to 2004, in an initial governmental accountability report back then, but government reports and others have talked about the need for coordination and information sharing between courts and SSA to better protect beneficiaries and address misuse and abuse. In the 2018 REP-Payee legislation, there was a mandate for a study of this issue by the Administrative Conference of the US, and the recent ACUS report on practical, technological, legal, and communications barriers to information sharing sharpened the view of these barriers and set out potential solutions. That's a very important, valuable report, and we continue to see this as an important need. Next slide. Okay, as to organizational payees, a big topic with a small amount of time, but I'll give it a try here. Setting aside for the moment institutional payees, which Pam will talk about in a minute, our findings on organizational payees were mixed. Our management survey results showed a pretty clear divide on almost every aspect of organizational payees. The managers were clearly divided on whether practices in appointing, field office practices in appointing payees vary, whether there are enough payees, organizational payees, whether organizational payees have adequate resources to serve beneficiaries, and whether organizational payees provide beneficiaries with greater access and contacts to community resources than do individual payees. So what you get is a picture, it's a really a picture of mixed perspectives without any predominant conclusion. Now, surely more thinking needs to be done about the ideal role of an organizational payee and the nature of its services and relationship to the beneficiaries. But we do know that they need to do more than just pass along the funds to beneficiaries. Fee-for-service organizations are viewed by SSA and by the staff that we interviewed as a last resort because they take a fee from the beneficiary's funds. Many staff told us about fee-for-service organizations that were not meeting their responsibilities, and in fact, sometimes were only, quote, conduit payees passing along the funds with no other services. and these clearly should not be allowed to function. We made a number of key recommendations about organizational payees, including first the need for organizational payee standards for staffing ratio, communication with beneficiaries, training, and more, and that this should apply to a range of organizational payees, including fee-for-service. We also recommended, looked at the need to differentiate nonprofit and governmental social service organizations as payees, look at that as a distinct category in the preference list, since they could offer important access to community resources like help finding supportive housing, mental health counseling, and so on. And so as rather than lumping them together with a larger range of organizational payees. We also recommended regular training and outreach by SSA for organizational payees about their duties and how to best meet beneficiary needs. And now is time for comments and questions. So I'll be open to, I guess it's one question, if that works.
There's a question from the public, from Ali Tabadapi. And he said, how did the interview methods control for negativity bias? Many SSA managers are extremely busy running their own office and programs. They may only come to understand the operations of a payee organization when one is not functioning properly. Operations within good payee agencies, like good referees, are not as noticeable when they are doing their jobs well.
Sure, that's an excellent question. And I'm going to turn that back to Laura, if that's okay, because she's really our expert on the survey design. And
You're muted, Laura.
Sorry, I beg your pardon. So the purpose of the design was really to do an exploratory study. We don't have the in-depth information that we'd like as if we were able to actually pull data from beneficiaries' forms. But the design really did allow us to look at staff practices and policies. So I feel like I'm not answering your question. So could you coach me a little bit about where you want, how I could be more specific?
I think the question was asking about the phenomenon where if man doesn't bite dog, there's no question. But if man bites dog, then there is a question. Bad news gets reported, good news doesn't. So the question is, in your survey, do you think you maybe saw a disproportionate share of mistakes and perhaps understate the value of, or the performance overall? Maybe I'm not stating the question correctly, but that's what I heard.
Yeah, so the survey was really focused on staff practices and policies, and it was really focused on their collective appraisal of what was happening. But what was really interesting about the responses to the survey is that they didn't bunch up on one end. Everybody wasn't very concerned about one issue and thought that other issues were not important. They literally, the responses were across the format of range of responses. And so I think that in some, there's a lot of variability in what's happening in terms of assignment of representative payees across offices. And so that's going to be something that will be talked about a few slides down. No, I think the survey was surprisingly, the answers were very honest and very helpful in understanding what are the key issues to work on. For example, the ERPS system is literally outdated and needs considerable work so that the SSA, the Social Security Administration officers can really put in data, and that data can be retained and retrieved easily and not lost. Oftentimes they talked about the system crashing.
Okay, I'm going to step in. Thank you, Dr. Sands. I'm going to step in and say that that was our one question, and I will proceed on to the last pieces of the report, and I'll be talking about institutional payees and practice inconsistencies. Thank you, Diane. So, of course, we talked to both field office staff and then NICSMA management to try to understand phenomenons of institutional payees, and then I will also talk about practice inconsistencies. So as I think we have heard before, but just to reiterate, staff really try to select family members or trusted individuals before selecting any other entity or individual, for example, a facility where the beneficiary resides. But when there is no one else to serve in that capacity, then they may move to an organization or an institutional payee, and mine is a little bit different from Erica's, because here I'm going to talk about group homes or nursing homes. One of the pieces that we wanted to talk about was what we saw as a conflict of interest, and that was actually sort of a mixed sort of issue. While some people saw that here was an organization that was paying for services and housing, but was also serving as a representative payee. Some staff said, I get it, but frankly, as long as they keep good records, that is fine. And then others found that problematic because they were concerned about some facilities taking advantage of the beneficiary. We had heard that there were problems with some facilities requiring that they serve as representative payees as a condition of admission. We heard much less from that from staff with whom we had interviews than we did on the survey, and I will talk about that. So some staff, and we point that out, that SSA does not audit nursing homes serving fewer than 50 residents and would not therefore review records about the allowance. And we believe that was an issue or concern that staff also raised. Also of concern was a resident moving from one facility to another, and delays that were occurring because of that change. So when we think about those issues, we refer to those as either institutional or creditor payees. We made a number of recommendations that we wanted to improve that. So we wanted to prohibit at all any appointment of facilities with contracts requiring the designation of the facility as a rep payee as a condition of admission. We go back to the face-to-face issue. Just as we have the issue coming at the window, we wanted to talk about the importance of having field office staff have a phone call, a video call, or a face-to-face meeting, some of which is not possible at the moment, but can be, to meet with beneficiaries and facilities, because that is really important that those technological solutions be worked out. We believe that there ought to be training materials for institutional payees on their duties, and regular training for those individuals, a theme that you are hearing again. Developing information for families and residents about what facilities are doing when they're serving as representative payees. And we also believe that there should be audits of payees with fewer than 50 residents. Also, we were somewhat surprised that there was such little contact with facility representative payees or institutional payees and the long-term care ombudsman. We think this is a missed opportunity, that the two could work together far more often than they could, some people having never heard of them. Next slide, please. The last component of our presentation in our study is that of practice inconsistencies. And there were inconsistencies that we found having to do with beneficiary preferences and family conflict, addressing requests to change payees, and inconsistencies related to geographic distance, substance abuse, and in selection related to the criminal history of the potential payee. Some staff, we did find really across the board as we interviewed them that they seemed exceptionally aware of POM's guidance. But they also indicated when we did an online survey that the individual employee could be very influential or moderately influential when selecting. So the person doing it really did affect who got selected. It could be a variable piece, and I think that's where the training issue could come in an important way. And then the application of some of the pieces of who got selected versus issues of substance abuse, issues of the criminal history bar, family location, geographic location, all somewhat vary depending on where the office was and who the staff was. Now, we would be the first to say that individual variation is a double-edged sword. Sometimes that's really absolutely important. Justice Brandeis said long ago about states as laboratories. That would be true for regional offices, for example, that they may know their own areas far better than making blanket provisions. But yet we believe somewhere in the middle, there is a way to come to that the decisions are not capricious necessarily, but follow steps that are replicable and consistent across the board. So we believe that while staff are keenly aware of the gravity of what they do, there need to be a little bit more guidance to them about how that they do it, so there is more consistency in what they do. Not surprisingly, we believe that there should be consistent staff training. We believe that there need to be face-to-face meetings when at all possible, and this can occur with a telephone call, a video call, a face-to-face meeting, what we're doing now, and things we have not dreamed up yet, but we can absolutely think of to do. I guess we have certainly seen the use of FaceTime in facilities in a way that we have never imagined before. If a beneficiary requests a change in payee, and this does occur, staff need not only the time, as I mentioned earlier, but they need to meet with both parties, either in person or through technology, to make sure that that is okay. There need to be additional policy and POMs concerning beneficiary substance abuse. How long, if a beneficiary is using substances, how does that factor into a decision? And then if a payee has had criminal history in the background or use of substance abuse, how long ago does that need to have occurred to say that that person may now be the right person to serve as a representative payee? That seemed to vary across staff. Some recognizing that what would be in the past 10 years ago perhaps may not be necessarily carried into the present, such that the individual may be the right and perfect appropriate representative payee. So, and then the other piece would be to help with those decisions so that the decision of just returning the benefit is made carefully, so that we not only preserve the autonomy of the beneficiary, but we protect the beneficiary in the right way. Again, that sort of delicate teeter-totter balance that we have talked about from the beginning of this presentation. And then the other piece is concerning developing additional policies about a crime, not one of the 12 barred crimes, that where a payee may be appropriate to serve in a particular capacity. And so those are my components of those two sections that we had. Next slide, please. I'll move on to the conclusions that we have, where we suggest some changes to the current system that may be appropriate. Next slide, please. So we grouped these into changes in policy, changes in POM guidance, administration, contacts and communication, forms, technology, training, and research. And so I won't go over all of these because you certainly have them there for you, but just to highlight a few, I think, that are pretty important. So one would be changing in policy, additional work on how DDS practices can really help in payee determinations is really critical, because these are sort of upstream issues and problems that affect the work done downstream at SSA. Then providing guidance to field office staff about criteria for determining the suitability of any guardian to serve as payee. You probably couldn't have a better person than Erica Wood to talk about these issues related to guardians. But certainly not every guardian is appropriate to serve as a representative payee. And then when, for example, there need to be, when a representative payee is changed, who is also a guardian, that needs to be communicated to the courts. And when a guardian is removed but stays as a representative payee, that creates a problem too. Again, the choices that I talked about, changes in POM's guide, changes in policies would be, I'm sorry, I switched again. So back to the training, meeting in person is really critical for changes in policy. Changes in administration, giving staff enough time to make the decision is really, really, really critical given the rights at stake. Piloting and evaluating potentially field office staff specialization is another important piece that we believe. Increasing the number of qualified and effective organizational payees is really important, and the training of them is important. We really believe that we should prohibit practices of conduit payees because we don't believe that that does much good for representative payees. There could be a better way to do the work that we do. Contacts and communication, also mentioned in the ACUS report, inform the court when a guardian is appointed as payee. And again, we believe that work with the ombudsman could really be very valuable and practical, a very practical solution to helping individuals who are in institutional settings. Next slide, please. Forms. Modify the instructions for the medical form. And another thing, give it a due date so that when it is due, it's due. That would be something that I think every one of us on this call knows. Technological changes. Require the visit. Face-to-face video call, meeting with beneficiaries, particularly for those in institutional settings. Here is another really important one that I hope is a takeaway for everybody. Resolve technological problems in the ERPS system, because that is a significant area of delay and glitch. And that could buy staff more time to make decisions appropriately and certainly reduce consternation they seem to have mentioned in field office staff. Training needs to be more consistent, more contemporaneous, and more often, both on the side of staff and for organizations, so that everybody knows what's expected. And I think that is a really critical piece. Last, peer discussions with staff to acknowledge how to make better decisions. It's a lost opportunity. Research. We have there examining DDS practices and pay determinations, but I would add another, having thought about this some more and not having put that bullet down, what are outcomes of having a representative payee? For having this system in place, what does that do for the individual beneficiary? Next slide, please. We wanted to leave you with some things to think about, not that I don't think we have already, but in a sort of ending, to what extent and how can supported decision-making greatly reduce the need for appointment of payees? As we learned, when organizations close, there were, in many instances, a list of people who didn't need a representative payee to begin with. So that only occurs when the organization closes, seems to me to indicate that there are probably individuals who don't need them, and that we need to think about can supported decision-making being an avenue for that. Can there be a more person-centered program that enables beneficiary self-determination while meeting their needs? A tall order and that balance that we discussed at the beginning of this presentation. Then if implementation of the recommendations for improving the selection process is not feasible, and I believe many of them are, should the payee program be located in another agency outside of SSA? But there are many pieces of recommendations that we have that are easily done that can really enhance the effectiveness of this program. Next slide, please. So there's the thank you slide. So we want to thank all the SSAB staff, Claire, Diane, and especially Conway, who worked with us to make arrangements, particularly me, as I traveled all across the country and got to speak with those amazing SSA staff. They are all a set of dedicated people, and getting to speak with 73 of them was truly a highlight of my life. NICSMA officers and members were so helpful, so dedicated, and frankly, a lot of fun to be around when they hosted us at the various states. Two graduate students, Emily Hoyt and Shengwang Du, helped us do some of the work that we did, the analytical work, the beautiful slides that you see were helpful by one of our students. 2 colleagues at other universities, because they were proximal to where we were going, Corey Bulkin at Washington State University and Ken Giroux at the University of Wyoming. I just want to close and tell you, we met highly dedicated people who were committed to trying to preserve the rights of individuals, people who were concerned about the work that they were doing and wanted to do the very best job possible. Not a single person who spent sometimes over an hour in an interview with me, when you see that their time was pressed, did this, who were not volunteers. No one was forced to come to talk to me. All those people did voluntarily, and they provided many, many, many suggestions that were doable, feasible, and in the best interest of the person for whom all this work is being done. So I want to say hats off to them for that. And it was a privilege to get to do that. And I think Erica and Laura and I all feel that way about the work that we have been doing. And I want to thank all of you for being on this, listening to this presentation from the 3 of us. Of course, you can see it took a village to get it done. And we want to thank all of you for the privilege of getting to do this work. Thank you.
Hi, everyone. My name is Bob Jundeff. I'm a board member, and I'm honored to be able to talk to our experts today about our report. And this panel is going to center in on the question of decision making, which is you might say is kind of turning the camera around, because while our topic is about individuals who need someone potentially to help them with making decisions in their lives, particularly with managing their money, what we're going to talk about in our panel is how Social Security is doing in making decisions about whether a person can make those types of decisions for themselves, and if they and how they do in determining what other person would be appropriate to make decisions for them if they need that type of assistance. And so today we have Michael Collins from the University of Wisconsin, Elizabeth Korda from GAO, Kate Lang from Justice and Aging, and Linda Rutland from the VA to help us talk through some of these issues. Everybody's on board. What we're hoping to do today is not to have presentations, but actually to have a conversation that addresses these questions. And so what I'm going to do is just kind of outline the core questions and ask our panelists to jump in and start the conversation. So the formal questions we're asking today is, does SSA correctly determine whether a person can manage their benefits or direct the management of their benefits? Do they assign payees to people who do not need them in some cases? And are there people who need a payee that don't get a payee? And also, when a payee is selected, is it the most appropriate person or organization? Is the most suitable person selected? And so, Mike, would you like to start us off?
Sure. So this is Michael Collins at the University of Wisconsin, and my work is focused on economically vulnerable people and decision-making for these populations. And I think one of the goals we talked about in the last presentation was around autonomy and justice, and that one of the goals we want to have is try to give people the maximum opportunity they can to make financial decisions for themselves. And unfortunately, in the world of representative payees, there isn't sort of a middle ground. You either are able to handle these financial tasks or you're not, and you have a representative payee take on some of these tasks. And so I think one of the middle ground is maybe a representative payee, but with a lot of designated activities that are actually conducted by the beneficiary. On the other hand, there's people who maybe don't have a representative payee, but use other technologies or services, community support systems to be able to try to take care of some of those tasks on their own without having to rely on representative payee. All of this is adding more complexity to what's already a complex system. We've already talked about how much training service providers, the payees, the guardians might need to be part of this process. And so the world I'm envisioning would actually require more of that support and training. But I think that would go a long way to expanding this idea of autonomy and justice and having more of a role for the beneficiaries. I'll turn it over to the other panelists, but I will just say that this is very consistent with what we see largely in sort of the financial household finance community right now around financial coaching. The idea of giving people the supports to pursue whatever their financial goals are, to pursue their own financial well-being. And so it's, I would say broadly, not just in the world of people with disabilities, but in the world of helping people manage their finances, there's a strong shift in the field towards this coaching model, this financial coaching model. And you may see it in your own lives, in the whether you work with financial advisors or other kind of roles, of asking people what their goals are and then giving them the tools to be able to reach those goals. And so I very much see the direction that representative payees, either in a more formal role or in these sort of support systems kind of model, is following that financial coaching kind of model.
Elizabeth?
Hi, I'm Elizabeth Curta from GAO, and I'm coming at this from the perspective of some work that we had done on organizational representative payees, most recently in 2019. And we also did an earlier study in 2013 that looked more generally at the oversight of representative payees. And so I have less to say about the sort of initial question, which is the, is SSA correctly determining if a person needs a payee? I think the study we just heard from raised some really intriguing questions about potential inconsistencies in how staff make these determinations. And when we at GAO hear inconsistency, we sort of jump to things like guidance and training. So I think the recommendations that the group has made, make a lot of sense to me. Just from the perspective of picking the most appropriate payee in the organization area, we did have some significant findings in the selection process for organization representative payees. In particular, we found that the policies on how to evaluate there are a variety of suitability criteria that the staff rely on to make these choices. But evaluating the more complex ones in areas such as the quality of financial management, internal communications between case management and the financial side of the organization, and record keeping did not provide sufficient detail for staff to be able to fully assess suitability. We also found that regional guidance varied considerably from one office to another, and there wasn't any sort of central review of all that guidance to see that is all this guidance really comporting with SSA policy, and are there sort of good practices that could be shared. And we also found that the field offices don't fully document their decisions, and this is similar to the study groups, some of their findings about the lack of documentation. And this is significant because if the staff don't document their rationale for why a payee is suitable, then when someone else gets that call about that organization or has to make a choice about where to place somebody, then they don't have that information available to them. So these were some significant shortcomings where we made recommendations.
Thank you. Kate, would you like to jump in?
Sure, thank you for having me. My name is Kate Lang, and I'm a senior staff attorney at Justice and Aging, where we're concerned about the rights of low-income older adults. I think there is no question that the representative payee program at the Social Security Administration is both under-inclusive and over-inclusive, that there are people who don't have a payee who need one and people who have a payee who don't need one, but it's difficult to get a handle on to quantify that problem or to see how large it is on either end. And I think that something that complicates the issue is that capability is not a static condition. right? That there is, just because I have the capability to manage my benefits today in September of 2020 doesn't mean that I'm necessarily going to have that capability a year from now or 5 years from now. And inversely, just because I need somebody to serve as my payee this month doesn't mean that a year from now or 5 years from now I'm still going to need a payee. So since people's financial capability is fluid and changes over time, that makes this question of whether somebody needs a payee or not additionally complicated, since it's not a static question where just because the answer is yes or no today means it's going to be the same answer in the future. I am particularly concerned about institutional payees being appointed for folks who live in those facilities. So I think what we learned in this report about 1/3 of managers reporting that they did not have any sort of contact with beneficiaries in those facilities when they appointed the institution as a payee. That's very troubling. I wholeheartedly support the recommendation that that needs to be a requirement. There needs to be some sort of actual individualized determination for those beneficiaries. And that there needs to be direct contact with them to see their actual capability. Just because the facility is saying that they want to be the payee doesn't mean that that individual actually needs to be a payee. And I also support the recommendation that there needs to be more oversight in terms of the contracts, those admission contracts for the facilities, and those facilities requiring that they be appointed as payee as a condition of admission should not be allowed, and that the Social Security Administration should be doing more to weed out that practice and to make sure they're not supporting it in any way. So I will pause there and wait for further questions.
Kate, you bring up a question about institutional settings when a person's in a nursing home or other institutional setting. I was just wondering if our technical experts might be able to help us in terms of the question of both how SSA addresses the question of people in institutions, and particularly whether they have the capacity to do individual interviews of people who might be in an institutional setting. We have Chris, David, and Rachel sitting out as our technical experts today, and I wonder if they could help us on that question. Perhaps not. Well, let's move on to Linda right now, just to make sure that we let everybody have their introductory concerns aired. Are you there, Linda?
I sure am. Good morning. Are you able to hear me?
Yes.
Oh, excellent. Linda Rutland, and I am an assistant director at the Department of Veteran Affairs. I work in pension and fiduciary service. And very much like SSA, we do have a fiduciary program that is similar to your SSA payee rep. I think that the recommendations are spot on. It's a fine line to appoint the right fiduciary, and in your case, the SSA rep. And it is a challenge at times. In VA, we do try to, if there's an existing relationship, whether it's a family member that has been assisting, or it's a family member that they want to help with the financial aspect of the VA benefits, we do try to do that first. But we do vet each fiduciary that's appointed. We do the criminal background check, credit check on that individual prior to appointment. So if it's a family member and they don't pass that portion of the vetting process, then obviously we would not appoint them. So there's a lot I think that you guys are looking at, that it's absolutely the right direction to go. One of the things that was brought out was about the I think consistency with the physicians, if you will, that are making those decisions as to whether or not the individual is able to handle their finances. In VA, we do look at in addition to the financial aspect of it, prior to deciding that an individual must have a rep, we do have to have medical evidence. So it's not an individual on our staff that's making that assessment outside of reading the medical evidence and compiling that information and then making that assessment. So those are some of the things that you all have talked about that are very critical and mentioned in as recommendations. So fully supportive, and appreciate you having me here to bring in our aspect of it.
That's great. I'm going to ask some specific questions, and actually they're questions that some of you have touched on already, but just to have a broader discussion, and please jump in as you see fit. One of our questions is: are there lessons to be learned from state guardianship processes, or the VA fiduciary process, or other processes? I think Michael brought up financial coaching as another area that might be helpful in this arena. Does anyone have any insights into other systems that have been using processes that might be valuable for SSA to consider?
Excuse me, this is David Lescarini. Can you hear me?
I can, David. Thank you.
Okay. Sorry about a while ago. That was user error on my part, trying to dial it, trying to get in. If I could just address your question from earlier concerning the institutions. So with the institutional payees, I know a lot of times we do try to contact the customer, the beneficiary, to talk with them, but sometimes what you run into is you have beneficiaries who are unable to talk on the phone. You have situations where the person they're not able to talk, either physically or mentally. They can't understand what you're doing. They can't even talk with you. They can't verbalize anything. And these are the situations that we run into. And so there is a difficulty when you're trying to do these interviews just over the phone to properly evaluate the individual. And so you end up a lot of times sending this Form 787 that was mentioned earlier, sending that to a doctor so you can at least have some other backing evidence that this person is incapable. I also think that when it comes to the employees being comfortable with nursing homes, for example, part of the reason is because I think employees, and I know in my experience, we've had situations, we all have these situations where we appoint a relative as the payee, and they do a good job up until the point that the person goes into the nursing home, for example. And then you get reports from the nursing home that the payee is not paying the bills. And that is a very real thing that happens. And so then you have to go down the road of, is this, why is that happening? Is the current payee misusing the benefits? And so I think employees become comfortable with appointing a nursing home, especially as a representative payee who has done a good job in the past and keeps good records. So I hope that helped some to the prior conversation.
It does. I have a follow-up question on that. Speaking as an advocate, oftentimes when a person is in an institution, it seems really, really helpful if there's someone, a family member or someone else outside who comes in and puts a second pair of eyes, if you will, on the person's situation. Whereas, but I could see that administratively, it'd be easier to just have the money process go through the institution. Are those factors ever considered?
I think so, because we have situations where it's not an automatic thing where we appoint a nursing home as a payee. Like I said, we do have individual family members that continue to serve as payee while somebody's in the nursing home, and that does give a second set of eyes. But speaking from experience, there's a kind of situation with a nursing home one time where they were sort of the nursing home of last resort, and oftentimes in their facility, every time we tried to get family members to serve as payee, they didn't want to do it for some reason. Mm-hmm. It just seemed to be that the population in that area, I guess, is what you would say. They're like, they're in the nursing home, let the nursing home handle it. So you do run into those differences, I think, across the country based on where you live, what type of environment you're in, whether it's rural, city, that sort of thing. So I think that is a factor.
Yeah. I have one other follow-up. I don't want to dominate this, but you mentioned both the ability of the facility to do proper accounting and sort of weighing that against the involvement of, say, a family member. Is there a way to weigh those two factors? Is one more important than the other?
As far as like on the front end, when you're trying to make a decision?
Yeah, in terms of the, I guess, importance to SSA as to whether the accounting is done properly or some other interest of the beneficiary is taken care of.
Well, I know with nursing homes, and I used to be a technician that took payee applications, and I've also done reviews of nursing homes as a institutional payee. And at least with nursing homes, they get a review every 3 years at a minimum. They're also reviewed by the state. They have guidelines they have to meet. So in my experience, they tend to have good records, and the records are easy to follow. So you at least have a history there of whether this nursing home is a good payee or not. With an individual, if it's somebody that has already served as payee and has done a good job, then you have that background there. But if it's someone who has never served as a payee, you just have to go with all the other information available as to who you think would be a better payee, because you have no evidence that this individual has served as a good payee. Furthermore, there's not a yearly review of individual payees, like that only serve one person, except for the representative payee accounting form that is mailed to them. It's a 2-page form that they fill out, and it's self-reporting. So unless a problem is reported to the agency, we're not going to go out and investigate this payee. Now, that did change recently with the new law that came out a couple of years ago, and there are some individual payees that get reviewed by by a third party, but that's not everybody. So I think that can weigh on a technician as far as their decision making.
Thanks. Kate, did you want to jump in?
Yeah, if I could just respond. I think that I understand what David is saying and the agency's reluctance to get into a dispute between parties about how benefits are being used. But I do think that it's important to recognize that fundamentally there is a conflict of interest between the beneficiary and an institutional payee. And that the institutional payee's interest is always going to be paying themselves first, not necessarily what's in the beneficiary's best interest. So I just think that it's important to highlight that, to bring that to the fore, and to emphasize that conflict of interest. I understand that it may be easier and more expedient for the people working in the Social Security office to appoint the institutional payee, but there is that fundamental conflict of interest that should not make it so easy and should give them pause. And I also want to say that there is a bias in our Medicaid system, in other systems, towards institutionalization for older adults. And I think we need to be shifting our systems to change that institutionalization bias. And particularly in these days of COVID, where institutional settings are particularly dangerous for older adults and put them at risk for infection, that we should be doing everything we can to support people living in the community rather than in institutional settings. So I feel like it's very important to raise up those issues today.
Other panelists like to comment on this? One other question that came to my mind was if a person who enters into an institution, say a nursing home, is de facto considered to be less able to make decisions with the assistance of others. We're talking a lot about supported decision-making today, and we'll be talking more about it. But it seems that if folks in those institutions are treated differently in that regard, that I'm not quite sure why that would be. And I'm wondering, is there a presumption that a person in an institution is less able to make decisions with the assistance of others?
This is Linda. I don't know that it's a presumption, but I think it's just, you know, the bottom line, the population that's in a nursing home, either they are physically unable to take care of themselves, or they are, you know, mentally or emotionally unable to take care of themselves, whether it's financial or physical. So I don't know that it's a presumption. I just think that there's a higher incidence just because of the nature of what it is. As far as the oversight piece in VA, we also do those on-site reviews. In many instances, if we appoint the facility, the VA benefits are completely exhausted with their monthly care. So that oversight piece is primarily for the well-being. But we also look at the facility to make sure that they are still in good standing with, you know, with the state. So hope that helps.
Yes.
Could I intercede a question? I've heard two people have now suggested we move away from institutionalization to the extent that's feasible. I understand that, and it's actually deinstitutionalization has been a movement for 40, 50 years, starting with, I think, mental health issues. What practically would you do different? What specifically are you recommending? I understand the sentiment and the goal of enabling people to remain to the maximum extent possible in their own homes or in other non-institutional settings with relatives perhaps. But what are you asking Social Security to do differently, or Medicaid to do differently?
Well, just one recommendation. I mean, this is obviously a larger conversation, as you point out, Henry, but one recommendation made in the report is for Social Security to do more investigation into the admissions contract when they are appointing a payee, to make sure the institution is not requiring that they be appointed payee for individuals who don't need a payee upon admission to the institution. I think that gets at this assumption that just because somebody is living in an institution, they automatically get a payee. So I think that that is definitely one recommendation. And also to the other recommendation I mentioned about actually making contact with the beneficiary. You know, David talked about individuals who are not able to communicate on the phone, but I still think that there is the need for that SSA staff person in the local office to make some sort of contact with the individual beneficiary so that they are making a capability determination for that individual, not based on assumptions they're making about institutionalized individuals, but actually what that beneficiary needs.
One question that was raised by a attendee was whether the type of technology that we're using right now could be used more effectively for people in institutional settings in order to have that eyes-on type of approach. Do we know if that's been being used now, either in Social Security or in other contexts?
This is Erica, and I'd like to point out that the pandemic has made a huge inroad on that question, and that the whole question of visitation of family members, of guardians, of anybody to a nursing home, you know, has had to be highly restricted. But CMS is very aware of the problem of isolation of individuals in nursing homes and has recently come out with guidance emphasizing the importance of, you know, really opening up that visitation with, obviously with conditions, but pointing out the importance of alternative means of communications, including things like Zoom and FaceTime, and the necessity for the nursing homes to facilitate that.
Great. I'd like to steer us back to an earlier question that we started on, and we took this fascinating alternative route. But are there lessons in state guardianship or other decision-making processes such as VA that can be good lessons for us here as we're looking at the Social Security processes? And anyone can jump in. Well, if you don't want to do that, I will move on to the next question. And this was raised also by one of our panelists, having to do with the dynamic nature of capability, as we call it. So for that there are many individuals for whom they may have the ability to handle their finances on one day and not on the next, having to do with changes in their abilities. Is there, does the process we have now account for that, account for the fact that ability to make decisions changes from day to day or from year to year, and how to best make sure that we're not interfering with a person's life inappropriately going forward?
I'll jump in on that, and it takes me back to the question of review, and it also takes me back to your former question about parallels with guardianship. So in guardianship, we find that there are very few restorations, and we find also that most courts take a fairly passive response once the guardian has been appointed and don't engage in extensive oversight or review. But courts are beginning to see the need for some regularized review. And I think that there's a real parallel there because we have changes in capacity, but there's no way to know about them, except, as we said earlier, if an institution closes, if there's a need for a change in payee. But basically, both systems are kind of passive in nature, so that unless there's a problem, things just tend to go along. And hopefully that's that could change.
And then this is Pam. I'd like to tag on to Eric, a big surprise, to say that if there is not enough time in the offices when people come to see if their funds can be returned to them, we would then those decisions can't be made thoughtfully and wisely and well. So the documentation issue, I think you're going to see you see sort of a string of actions, actionable items, if the documentation is cleaner and consistent and guides people. And if there is proper training and time to make the decisions, then one, people who don't need representative payees won't need them, so there won't need to be the oversight or the change. And secondly, when capability fluctuates, then people return for a revisit on this issue, then there would be the time, the thinking, and the review to be able to make that decision well.
Go ahead, sorry.
No, I've already talked enough. You go, Michael.
I was just going to say, you asked the question sort of within persons, do we have changes in financial capability, which I completely agree. I think there's also, we need to recognize that the nature of financial capability is changing over time too. So if you look at some of the questions that have been used in the past to assess people's financial capability, there were things like balancing a checkbook register, which for many people today is irrelevant because their iPhone is the math is done for them. So whether they have diminished numeracy really isn't as much of an issue. So as payment systems and banking technology and these other aspects change, I think we have to think about what it is that we're trying to assess in some of these capability metrics or checklists that are out there, because they've changed as the financial system has changed.
This is Elizabeth. It occurs to me in this sort of dynamic discussion that in some of the disability programs, there are mechanisms that trigger reviews, continuing disability review, and often those are they're scheduled. So someone sees an opportunity, a possibility of a medical improvement, so they put a flag in the system to say, okay, this triggers a review. I mean, it's theoretically possible, to think of this process of making a capability decision as something with a similar kind of a flag to say, like, well, right now, that it seems like this is not. This person is not capable, but this could change, and maybe check on this in X number of years, just to kind of put something in the system that would prompt someone to take another look.
And this is Kate. I want to kind of look at the under-inclusive side of this. We've been talking about people who have payees who may no longer need them, but there are also people particularly receiving retirement or survivors benefits based on age. And it's not unusual as people age to experience some cognitive decline that would require them to need assistance with financial management as they age. I think that for many people, as Michael points out, there's technology, there are other arrangements that don't require a payee. I think there is a smaller subset of people with cognitive decline who don't have those supports in place, that where a payee may be needed, but there is no way for Social Security to know about that until there is, a disaster, a big problem.
This is David.
Yeah, David.
Oh, I was just going to say concerning putting something in the system that would bring up the need to reevaluate a payee. I will say that, or capability, I will say that for SSI recipients, adult SSI recipients, when we do a redetermination, that is one thing we're supposed to look at if they have a payee, is whether or not they have improved and can serve as their own payee. So that is out there, but just for a very small population.
Hey, Bob,
Yes, please.
question. Actually, this question is for Michael. And Michael, I'm wondering about, in the work that you've done with respect to financial counseling, keeping in mind that people who are eligible for Social Security disability benefits, are the most severely disabled, often, obviously physically and emotionally. Is the financial counseling kind of industry, is there a significant enough emphasis on kind of those special needs? And you know, kind of therefore, is there that pool of support for these folks available in your view?
Short answer is no. So, you know, National Disability, NDI, National Disability Institute, Role Dynamics. I mean, there's a number of good examples of community-based organizations out there that are delivering. They've developed training, they're delivering training, they're trying to build the capacity of providers. But often, particularly when it comes to programs like financial coaching, trying to find providers who really understand the special needs of populations combined with the detailed nature of some of the programs that people are involved in, it is definitely an area where it's a relatively small set of providers. I sort of opened my remarks with, I imagine a world that has all these services, but I also recognize that these services are expensive. And so, yes, this is something that will take investment. But if autonomy and justice are part of the goals, a part of the where we're trying to get to, investing more in that infrastructure, I think, is going to be important. And I would say this goes not just for the beneficiaries who are hopefully going to become able to take more of the the financial capability for themselves. It's also in many cases the representative payees, because oftentimes they are themselves very economically vulnerable. They are also very low income, tend to have a lot of debt, really tend to be struggle. It's a marker of economic vulnerability oftentimes, especially when you're talking about non-elderly, but also true for elderly. So I do think there is a lot of room to help support people in that payee position as well as the beneficiary themselves.
We have some very good questions coming in on our question and answer line, it's called. And a couple of them have to do with the distinction or similarity or difference between something like a nursing home, an institutional setting, and when there's an organizational payee assisting a person who's in a group home, say a 3-bed shared living situation for people with intellectual disabilities or mental health issues. Are there different considerations there? In terms of the questions, I think there's both a concern that they're not the same and whether they're treated the same, and secondly, whether there's the same level of attention given to the smaller congregate settings. Would anyone like to address those questions?
I mean, I could sort of kick that off because we did look at the oversight of the different kinds of organizations, and SSA takes a risk-based approach, and so sort of segments the different organizations into categories, fee-for-service, high volume, mental institutions, and low volume payees. And the low volume payees are the ones that get the least scrutiny, even though they represent the majority of the organizations. And so the way that works is they have a model they use to predict potential sort of bad behavior, and they apply that to this population of low volume payees, and they pick a few every year, a number every year to do on-site reviews, this sort of extra scrutiny that the other categories get on a more routine scheduled basis every 3 to 4 years. And so it's really only a very small percentage of the organizations in that category, something like 6% in a given year, that get an on-site review. So there are a lot that are not getting that kind of scrutiny. And, this is an area where, again, we made some recommendations to, in a number of areas, including adding an organization where payees to their risk assessments. They had sort of planned to take a look at this from a risk perspective, but we suggested that they take into account some of the findings from the audits that come out of these kinds of entities. For example, commingling of collective funds, where often that's a finding from the site reviews that something is not working well there. So take that into account into some of the risk assessments. but also the model itself. You know, we could not evaluate the model because there was no documentation as to how it was designed or, you know, what it was supposed to accomplish. And so we recommended that because they had plans to revise the model, that they, as they do that, that they take into account other sources of information, such as from CMS, nursing home information. They have a lot of information about potential bad actors in the nursing home realm, and that could be taken into account into their modeling, and that they certainly that they document it so they, you know, future users of the model can understand it.
To your knowledge, was anything done to follow up on your suggestions?
They agreed with all of our recommendations in that report, and they
That's a different question.
Yeah, no, I was getting there. You know, they said that they had plans to address everything. We have not sort of gone back to say, like, have you actually done something yet? So this was just, you know, we just looked at it a few months ago.
Ah, I see. Thank you.
One question that was raised is, and I don't know if we're prepared to answer it, but if P&As have been considered to assist in making suitability determinations for representative payees. Is that anything that our panelists might be aware of, or our technical experts?
I am not aware that the local office would consult with the P&A about a payee before they're appointed. I think that Social Security obviously is receiving the reviews from the P&As, but it's really up to them as to how widely that information is distributed. Who knows what is in the review and what use is made of it. But that is, I think, a really great source of information going into the future that could be, you know, incorporated into what information somebody in a local office uses when they are considering appointing a payee.
Do we happen to know, or do any of you know, if there's been research into the effects of taking away a person's right to manage their own funds, if it has an effect upon them psychologically or in terms of their development? I mean, there seems to be an assumption that it's a violation of rights, certainly, to take that away, but does it affect a person's, does it help to atrophy a person's abilities, I guess is the question. Do we are aware of any research on that?
Bob, we know from the gerontological side of the house that when we start taking away persons' autonomy, it affects their health, their social engagement, rates of depression. So we do have some of that information about how important it is for, I don't know just about finances, but I know overall, when we start taking away those kinds of issues, there is literature on that.
Okay. So just a comment, in the category of first do no harm, making the wrong decision might cause harm, as well as some type of removal of a legal right. One of the questions that we have is that as part of the 2018 Strengthening Protections Act, SSA issued a request for comments about its selection process and the order of preference lists. And remember that the order of preference is written to give certain preference to individuals or groups in determining whether they're appropriate to be a representative payee. So are we aware of any feedback that's been received from the public on those questions? We have a lot of good questions that remain unanswered here.
Just to highlight one of the recommendations from this report is to create a category of community-based nonprofit payees that I think really is a wonderful recommendation that should be adopted by the Social Security Administration as they revisit the preferences, particularly for adults without substance abuse issues, I think that that category should be added and given preference. And I think that personally, I think that the private facilities, such as group homes, nursing homes, should be moved down the order of preference, particularly for adults without substance abuse issues, and be treated more like fee-for-service payees.
Have we learned anything during this COVID period that might be valuable for us in moving ahead on both the assessment of capacity or capability and suitability of the payee?
Well, certainly to return to the technology, COVID has really taught us that there are a vast range of technological ways to keep in touch and to prevent isolation, particularly to those people who don't have a voice, like individuals in nursing homes. And the ease of using those has really blossomed during the pandemic. And so I think that that's a huge factor here, not only for SSA, but in payees, but for guardians and all kinds of other settings involving people who don't have a voice.
This is Linda. I can certainly echo that. In VA, we typically require a face-to-face field examination when we appoint a fiduciary. So we would meet with both the fiduciary and the beneficiary in a face-to-face environment. And we have been able to fast track moving into using technology to keep in touch. It does make a difference. It's just like with this meeting we're doing today, having the ability to see, the panelists and individuals, it helps you feel a little more connected. And we have been doing all of our field exams with both the beneficiary and the fiduciary in a virtual environment for the duration of COVID. And we intend on incorporating this into our standard protocol. There are reasons to do a face-to-face. In some instances, we will continue to do face-to-face as we deem appropriate, but to include the video conferencing capability as a means to check in on the individual is definitely going to be a part of our protocol.
Mm-hmm. Here's a question from one of our viewers. The question of how it works really practically on the ground when a beneficiary reports that they have increased capability and they request direct pay, or maybe when a P&A reviewer or some other individual contacts SSA and reports that. What actually occurs? David?
This is David. I'll try to.
Hi, this is Chris.
Oh, go ahead, Chris.
Chris? Are you? I see a mute button here. So David,
I just wanted to make sure
that
you can hear me.
I think we're having some.
Can you hear me?
Yes, please go ahead. Well, we can't hear you anymore.
This
David,
is David. Yes, I'll try to answer. So when an individual who has a payee, if they contact us and say that they believe they're capable, that causes us to do an investigation at that point. That's what we should be doing. So we should talk with the customer themselves, develop lay evidence, which might be, and start off with questions with the customer, about how do they feel like they can handle their own funds? Have they been handling some of their own funds, paying some of their own bills? Then we would contact the current payee and interview them. And so we would gather evidence concerning capability of paying bills. Are they responsible for keeping doctor's appointments? I mean, those sorts of things. There's not any one way to do it, but it would start the investigation process to see if we think that the person can be their own payee. I will say that if we got to the point where it's maybe 50-50, then the employee might send a 787 to a doctor just to get another opinion on that.
When you're sending the form, would that form be decisive? And just to elaborate a little bit, is that particularly in the supported decision-making conceptual area, there's a difference between, say, organic capability and the ability of a person to make decisions with the assistance of those around them, natural supports and so forth. Is normally the 787 a definitive document, if you will?
I would not say it is. I think employees, if they deal with certain doctors enough, they know which doctors are going to give actually fill out the form correctly, which is one of the biggest problems, as a medical provider, filling out the form correctly and giving good information. And so part of the determination, I'm sure, depends on who is the primary physician for this individual. The other thing is, we have the capability, if it's sort of a toss-up there, we have the capability of setting the person up as their own payee for a short amount of time and explaining to them, look, this is what you need to do. You need to keep records, and everything, and then you come back in and see us in 30, 60, or 90 days, and we will review what you have and make, the proofs you kept, and you can show to us whether you're, in other words, giving the person an opportunity to show to us whether they're capable or not.
Right.
And if we find this, and if they do a good job, then they can stay their own payee. And if they don't, then we'll have to look for another payee or the prior payee.
Two more questions that you might be the right person, David, or not. One is, does SSA have best practices related to staff to client ratios for organizational payees?
Not that I'm aware of, but at my level, I honestly just don't know. I can't answer that.
Bob, could I go back a step to an earlier comment or question, which was that there was a great potential for using video or phone connections with individuals to gather information, to do, if you will, examinations. I'm sure most of us here have, during the COVID period, had some interactions with physicians, either by phone or by Zoom or some other video connection. Physicians are now able to bill for such visits. But Social Security finds that this mode of communication is unacceptable because we have been told the risk of leaking personally identifiable information. So my question is either to Lou or Ken, or to those people from NICSMA, anybody from Social Security, why it is, in your view, that Social Security is unable to do what the rest of us are doing on a rather routine basis these days? And what steps could be taken to encourage them to enter the 21st century.
Henry, this is Lou. Can you hear me?
Perfect.
I think, and I don't pretend to be absolutely up to date on what's keeping them, but I can say that in the past, it's a combination of both technology and the oversight by the legal folks who keep that from happening, the general counsel's office and so forth, who perhaps are extra cautious in some areas of Social Security. So, but I think, I also think the technology of them being able to use this technology and ensure the privacy is a question that needs to be explored. And so perhaps somebody's done it, but it's not always easy. You seem to be constrained more there than in some other areas.
I would like to hear from, I'd like to hear from David on this, because I think that there is quite a bit of technology that is, certainly there's a need for greater technology, but whether it be in disability adjudication, there's an effort to, that from my experience has been moving more in the direction of using technology to be able to resolve these issues. And that's been, that's my sense, but I'd like to hear from David whether his take is that that's also the direction that things are moving in, even with Lou's caveats that, you know, we're not too fast at it. So that's a question for David.
So I know that the hearing offices are going to start video hearings, I believe using the Microsoft Teams platform. We do not currently have that platform in the field, but I know that it will be rolling out at some time. I don't have a time frame, but roughly within the next 3 to 6 months, they'll start rolling it out. I'm not aware of how they intend for us to use that platform. I don't know if it will allow us to talk to our customers, you know, outside of our firewall, or if it's just going to be used internally for employees to talk with each other and components to talk to each other. But I do know that the hearing office is converting to doing video hearings.
Could I add one other thing, which is it is sensational that David is here and part of this to provide the kind of on the ground assessment. I'm a little saddened that we don't have the national policy folks here too, because there's been 2 or 3 times that there've been questions that have been raised that I think they could help with. And I know that it's hard sometimes when you're dealing with an advisory board. I know the history of the challenge of working with the advisory board. I had to face those issues myself when Stan Ross, who just recently died, was the chair. Sometimes issues get raised and they're hard to struggle and deal with, but the board can provide some really good, a second perspective to be able to help the agency. And so I just think that to the extent that in the future, the national office could be present for these to complement David's assessments, I think it would be good for the greater good for this issue and many other issues that the Social Security Advisory Board confronts.
Amen, Ken.
Are we ready? Well, this is Lou. I wanted to jump in and say I agree with Ken, the national perspective, and I think in our panel, we need to make those kind of recommendations that involve somebody at the national level picking up everything that's come out of this today, because there's some valuable information that is being shared by a group of people with new eyes looking at this program. So I agree.
They were invited.
We've come up to the end of our time, so I'm just going to hand it over to Kim and just say thank you so very much, panelists and others, for participating in this panel. If your question wasn't answered, viewers, in this panel, we can bring it up in the next one. So do not despair. Kim?
Well, thank you so much, Bob. Thank you, panelists. Great discussion. I will say that the board is going to have some executive session time tomorrow where we'll be meeting with the commissioner directly. So hopefully we might be able to get some answers. So we'll look forward to that. And we are now approaching, according to our agenda, a lunch break. So everyone has 30 minutes to take care of their personal business and have lunch. And we will reconvene at 12:30 with our speaker. So thank you so much, and we'll see you soon.
So our keynote speaker today is the Honorable Kristen Booth Glenn, who responded to my email request to participate in the forum, that she was really jammed, but that she couldn't turn down the opportunity to talk about this really important topic. Judge Glenn is the Project Director of Supported Decision Making in New York. She was the Dean of New York Law School. Is a retired surrogate judge of New York County, where she had jurisdiction over guardianships of persons with intellectual disabilities and wrote several groundbreaking decisions in that area. She writes and speaks on supported decision making as an alternative to guardianship and advocates for locating personhood within the human right of legal capacity, which I think she is going to talk about today. I thank Judge Glenn for joining us today as our keynote speaker. And additionally, she has agreed to join our third panel. So we won't have a lot of time for questions, but if you save your questions, we can try to cover some of them in the third panel. Thanks so much.
Thanks so much for inviting me. And just a quick note about the slides. Diane is graciously, I think, going to advance, so I'll just say next if I remember. And also for people who are watching, there's a lot of text. I don't read slides. I hate people who do that. But if they will be available apparently on the site or in some other way, so don't feel bad if something zooms past you. So I think my title is a good place to start. What does human rights have to do with the REP Payee program? And for that matter, what does supported decision making, which to save time from now on I'll refer to as SDM, have to do with it as well? SSA is an agency that deals with money, not by and large human services. Even in the REP Payee program, the main tasks are choosing REP Payees and then making sure that they don't misuse beneficiaries' funds. Of course, there's also the determination of capability that we heard about this morning, but that's largely about where to send the money and making sure that you've got good payees. And I don't mean to suggest in any way that SSA and its employees don't have a heart or that they don't recognize that beneficiaries are human beings, but the well-being of the beneficiaries as opposed to the appropriate use of their funds is understandably not the prime consideration. But the beneficiaries are human beings, and the decision to remove their right to control and spend their funds, much like the imposition of a guardian of the property for people with disabilities found incapacitated in judicial proceedings, can have a profound impact on their lives. As you consider possible changes to the REP Payee program, I want to ask you to think how those changes may limit or alternatively enhance the autonomy, and let me even posit the ability to thrive of those individual human beings involved in the process. This issue came up this morning in the first panel, and I think it's useful to note that there is such a profound impact on people by taking away their rights. And this is not just my view. In a 2018 report, which I can wave at you here, that was written by the National Council on Disability, and then which was also reiterated in a 2019 report. They wrote, studies have found that when a person loses the right to make his or her own decisions, there will likely be a negative impact on the person's functional abilities, physical and mental health, and general well-being. People subject to guardianship can feel helpless, hopeless, and self-critical, and experience low self-esteem, passivity, and feelings of inadequacy and incompetency, as well as significantly decreased physical and mental health, longevity, ability to function, and reports of subjective well-being. So to the extent that taking away someone's right to spend their money and control their money is the functional equivalent, I think that you can see what that impact is. The lens that I'd like to suggest that you use in your deliberations is like that which we have used in attempting to limit guardianship through the use of SDM, that of human rights. But first, since I'm guessing that there may at least be some people here who have no idea of what SDM is, although there'll certainly be much more said in the third panel, here's a quick definition. Next slide. SDM is something that people have been doing informally forever, but it has taken on a new salience over the past several years as it has come to be seen as a viable, less restrictive alternative to guardianship. And I know that ACL has taken this position. We've got some folks from ACL here, and thank you for that. The interesting point for this discussion, though, I think, is where this iteration of SDM comes from. Next. Of course, it's something that we all do, that is, use various kinds of supports to make decisions, including doing research on the web, talking to friends and family, utilizing experts like accountants or lawyers, etc. But the driving force as supported decision-making has emerged as an alternative to guardianship has been human rights, and specifically the United Nations Convention on the Rights of Persons with Disabilities, or the CRPD. I don't know how familiar you may be with human rights, and if you are already quite knowledgeable, please forgive me. But I have to admit that when I started this work, I knew virtually nothing, so I hope you'll indulge me in a very brief explication. Next. Unlike the rights given by the Constitution or statutes, which can be altered or taken away, something that I think we're all quite conscious of as we look at the appointment of a new Supreme Court justice, human rights are inalienable. Slide 5, please. They are also indivisible, that is, you can't slice and dice them. And they are interrelated and interdependent in the sense that each relies on and is inextricably connected to others. So that, for example, rights to education or political participation depend on the satisfaction of a person's right to adequate food, water, shelter, etc. Unlike most of our constitutional rights, which say what the government cannot do, think Congress can make no law in the First Amendment, they include positive rights, exactly like the rights that I've just mentioned, to adequate nutrition, education, shelter, etc. And while concepts like equality and non-discrimination are familiar to us from our own Constitution, there is a third fundamental basis for human rights: dignity. Next. This is reflected in the germinal, I use a gender specific term here rather than seminal, in the germinal document of modern human rights, the Universal Declaration of Human Rights. And I like to think that in these difficult times, the words of the Universal Declaration are really something that's worth getting behind. So where do human rights come from? Next. Human rights, as we think about them now, really emerged out of the disaster of World War II, the genocide, the Holocaust, and all of the nations of the world coming together and saying, we have to do something so this never happens again. So the United Nations was created in 1946, and one of its first major acts was to promote and cause the writing and then the signing of the Universal Declaration of Human Rights in 1948. It was signed by everyone in the world. It is aspirational, but it has moral weight, and it announced and recognized the rights to which all persons are entitled by virtue of being born human. So there have been many subsequent treaties, including the ICCPR, to which the US is a signatory and has ratified. And those conventions all involve legal principles and rights that the nations that ratify, who are referred to in the conventions as states parties, that they must satisfy those rights, and those are legal obligations. Next. In the course of many conventions being written, it became apparent that there are certain vulnerable groups for whom the rights that are enunciated as the basic human rights in the Universal Declaration are not likely to be available without additional efforts on the part of nation states. Those 5 vulnerable groups are racial and ethnic minorities, children, women, people with disabilities, and older persons. And as you can see, 4 of those 5 groups now have their own conventions, with people with disabilities through the CRPD being the last. Older persons is something that's still in process in the UN. Next. So the CRPD is the most recent convention, and it aims to ensure that people with disabilities enjoy all human rights, everything that's in the Universal Declaration, on an equal basis with others. And of course, this includes the underlying right of human dignity. And this is reflected in the general principles that guide the CRPD. Next. Article 12 is the salient article for our purposes, and it does 2 important things. Next. First, in section 2, it guarantees the right of legal capacity on equal basis with all others. And I'll share the definition of legal capacity with you in a moment. What it also does, though, importantly in section 3, is declare that governments or state parties are responsible for providing access to the supports necessary to enable people with disabilities to exercise their right to legal capacity, just like everyone else. This is where SDM comes from. The words supported decision-making are not actually in the convention, but the interpretive documents that have come out since refer specifically to paragraph 3 and speak of supported decision-making as the way that this is to be done. So next, legal capacity is not just the right to make your own choices and decisions, as you just saw in the definition of dignity in the general principles, but it's also the right to have those choices legally recognized and acted on. Supported decision-making, as we are now thinking about it, and in the case of the pilot project that I direct, is facilitating people with disabilities to identify and use the supports that they need and choose in order to make their own decisions. And then, although we haven't gotten there yet in New York, by enacting statutes, as 10 states and DC have already done, that require third parties who might often question the capacity of people with disabilities, often out of fear of liability, sometimes because of stigma or prejudice, sometimes both, to honor those decisions. But to go back to section 3 of Article 12 as a matter of human rights, it is government that has the responsibility to provide access to the support they may need. That is how the right of legal capacity is operationalized. So why should all of this matter to SSA or to the REP Payee program or to you who are watching wherever you are situated? I'd like to do a little exercise now that would, in a pre-COVID conference setting, where also we'd get to talk in the halls and have a drink at the end and do all that wonderful networking. In a pre-COVID conference setting, I would ask everybody to stand up and stretch and find a partner and have a conversation with the partner. And then in that conversation, I would ask you to answer 2 sets of questions. So now, of course, although you are free to stand up, I would ask you to answer the questions by typing your answers into the Q&A box, which is at the bottom of your screen towards the right-hand side. And even though it would look like you would be typing questions, the people who are monitoring this will see them as the answers. We're, of course, short of time, so you only have 3 or 4 minutes, but I promise that the questions aren't hard. So here they are. First, what are 5 nouns that describe you, not adjectives like kind, thoughtful, brilliant, loving, etc. Nouns, like in my case, for example, lawyer, right? And then the second question is, what are 3 purchases that you have made over the last week or so? Okay, so I'm going to give you like 3 minutes. Please, please, please type, think about this. This is really trying to bring it home, and type your answers into the Q&A box. And then I think our wonderful tech staff will call out a bunch of them to me and then I'll make some point or not. Okay, thanks. I'm not seeing answers show up, but maybe I don't know how to do this.
So we have a few.
Okay, so people should keep doing it.
Yeah, we have mother.
Wait,
Oh,
wait.
sorry.
Let's get some more. Let's get a few more.
We're also, you can see them if you go to the Q&A answered space. We've been pushing them up there.
Oh, I see. I had to scroll down. That was my problem.
Mm-hmm.
Somebody said caring. That's an adjective. Caring what? Okay, one more minute. And don't forget your 3 purchases, even though you might, in retrospect, prefer to forget them. Come on, Lou, give us some nouns.
So I think most of the questions have stopped coming in, but we've again published all the answers. So if you just go to the answer piece, you should be able to see them.
Can you just, for me, just read some nouns out?
Sure. Sure. So mother, fighter, advocate, yogi, reader, musician, and I'm just pulling from a lot. Analyst, consultant, employee, brother, earner, wife, mother, grandmother, friend, executive director. Those are purchases. Some adjectives.
I always wonder why people have this trouble with noun and adjectives, but
Social worker, accountant, friend, wife, mother, human teacher, spouse, lawyer, gardener, outdoors woman, dog lover.
oh, good. Stop. I always love it when people put like nice things that they do that's not part of their jobs. So let me just look at those nouns for a second, right? Clearly, you could not be whoever you are who is given me these nouns, or whatever, for people who didn't give me nouns, the ones you've thought about for yourself. You couldn't be any of those things, any of those nouns, without having made multiple decisions, right? I mean, to be a mother, to be a lawyer, to be a spouse, to be a reader, to be a birder, whatever it is, there are many, many decisions that go into that, whether it's, buying books about birds or going on the web, or whether it's, talking to all your friends about, should you marry this person or not. there are many, many decisions, right? And if you were not able to make those decisions, or if you were prevented from making those decisions about these nouns that you've put out as being who you are, who would you be? To put it another way, your very personhood, who you are, is the sum total and the consequence of the decisions that you've made in your life. So if you can't make decisions, how can you be a person? I'm guessing as well that a lot of those decisions, either directly or indirectly, involved money. I mean, if you decide to become a parent, presumably you're weighing whether you have the resources to support a child. If you have a hobby, you decide whether you have the money that will enable you to pursue that hobby. If you decide to get married or to take a particular job, money figures into that, and the ability to spend your money figures into it. So the ability to control and use money also becomes a necessary part of personhood. This is why the ability to make decisions, including the ability to make decisions about money, is so deeply fundamental to who we are and to who we can become. So now let's think about the second question, the stuff you've bought. Do we have a few things that people have bought?
We do. Food, rent, art, books, shoes, flu shots, medication, toys for grandkids, bicycle rack, cat food, groceries, a mattress, gas, groceries, purse, groceries, hygiene products, beer,
Okay,
ice maker.
Let's stop with beer. I love beer.
Okay.
So obviously this is wonderful because it's a range of things that are really important, like rent, so that you have a roof over your head, and medicine, and then, well, maybe beer is essential, and so is cat food. But anyway, you see the point. So, you know, maybe these were good purchases. Some of them were certainly essential. Maybe some of them you regret thinking back on them. But what if somebody with the power told you that it didn't matter what you wanted, you couldn't use your money for those purchases? How would you feel? And then if it happened over and over, how would you feel? Who would you be? Ultimately, I think it's about your dignity. It's about the recognition of you as a full participant in your own life and as a participant in the world. So personhood and dignity, that's what being able to make decisions about your money are about. And that's what we're talking about taking away when we appoint a rep payee for someone. So this is why human rights are important. I know that a number of people here have already begun thinking that maybe something like supported decision-making might be utilized to maximize the number of people who control their own funds, as opposed to giving someone else or some other entity, because we talked about that this morning too, complete power over those funds. And I really applaud and am grateful to SSAB for putting together this forum so that you can explore issues like having government, to paraphrase Article 12, provide access to the supports people with disabilities need in order to exercise their legal capacity, including their legal capacity to spend their own money and to make their own decisions about how it is to be spent. Now, I mean, I think it's pretty obvious that there aren't easy answers to these questions. And, you know, I have some ideas that will come up in the third panel, and I know other people do as well. But obviously, these concerns and the resources to deal with them aren't built into the architecture of SSA. Next slide. I think I've probably missed some slides, so next. Oh, no, perfect. So I also have to be completely honest with you, and this is a sort of sad and grim slide because this is the nations in the world that have ratified the CRPD or ratified the CRPD plus the optional protocol. You don't need to know any of that. You'll notice that there are very few that are not either red or blue, that are yellow, and and it looks like there are more than there are because Alaska up there looks like its own country, but it's not. But there's the US, and the company that it's in is Sudan, North Korea, not great company. But unlike the more than 170 countries in the rest of the world that have ratified the US hasn't. It doesn't ratify many human rights treaties. So protection and promotion of human rights, including the human right of legal capacity, is not mandated here. Slide 14, please. Just to recap. But human rights are also both aspirational and inspirational. They can be a North Star as to how we think and how we act. I want to leave you with a quote from a paper that I came across recently, which is the next slide. Next, please. The author, who is asking what we can possibly do for the health of the billions of people who are suffering around the world in the face of this pandemic, turns to the human right to health to, quote, inspire advocates, claimants, and those with the responsibility for fulfilling the right to try hard to satisfy its claims. She says that appeal to the human right should, and often does, give rise to the virtue of creative resolve. I love that phrase, the virtue of creative resolve. Hold it close. The author describes this resolve as embodying a fundamental commitment to finding creative solutions to dilemmas. She tells us not to reject that right, even if the right itself cannot tell us, as in the case of health, which is what she's considering, how to ration scarce resources. Instead, she says, the right gives us a response in motivating us to search for ways for fulfilling the need. I hope that I've been able at least to spark that virtue of creative resolve as you engage in the remainder of this forum and use a human rights lens to look for ways to meet the needs of beneficiaries for autonomy, self-determination, and perhaps most of all for dignity. Thanks. Thanks.
Thank you,
Thank
Judge
you
Glenn.
so much. Thank you so much. Really appreciate those remarks. Very insightful and very helpful for those of us who are not as familiar with supported decision making. So thank you so much. Okay, we will now turn to our next panel. And Henry, I believe this is yours.
I hope it's ours.
Yours is the moderator. How's that?
That's different. I want to thank everybody who participated this morning. A great many questions were raised and a great many suggestions about how to improve matters. As an economist, I often think about what things cost, both in terms of money and in terms of staff time. These considerations are particularly important at the Social Security Administration, which has a great many things to do and probably less money to do them, certainly than they would like to have, and very possibly than they should have to do them. So the question that I would like to pose to the panelists in this second session, and I'll call by name if I have to, but I'd rather you leapt in unbidden.
Did you call me?
There is so much that needs to be done to be improved with respect to the REP Payee program, including starting with the determination of the need for a payee, the selection of a payee, the training of a payee, the review and oversight of the performance of the payee, redetermination of need for the beneficiary to have a payee, sometimes meaning that a payee is no longer needed, sometimes meaning that a new need not previously recognized has arisen. Against that background, money is short, staff time is short. Policy making is choice among competing wants. So the question I would put to the panelists, and I'll go by whatever order we need to, but the question I would put to the panelists is, given the abundance of various desirable uses of funds and the scarcity of them, where in the REP Payee program would you start to improve oversight? What research would you find useful in order to make those decisions? The panelists this afternoon are Reeve Bull from ACUS, Kurt Decker from NDRN, Ed Noonan from the National Association of Organizational Rep Payees, Kate Lang from Justice in Aging, Kathy Laren from the Governmental Accountability Office. The researchers who presented this morning, and in the background, but I hope not really, are Chris Detzler and David Lescarini, both of whom spoke some this morning. So I've put a very broad question on the table, and I would ask one of you to begin. As a strong believer in alphabetical order, it's been of great service to me throughout my lifetime. I will start with Reeve Bull if nobody else speaks up. Reeve?
Yes, happy to jump in. Hopefully everyone can hear me all right.
Loud and clear.
Wonderful. Okay, so first of all, thank you, Henry, for putting together this panel, and I'm delighted to be able to participate, and thanks to Claire and Kim and everyone else at SSAB as well. So I think you're precisely right to put the focus on money, limited resources. That was definitely a major issue in the background as we at ACUS were doing our report on the REP Payee system, and specifically information sharing between the state courts as well as SSA. And in that light, I think that's probably the piece that I'd be most interested in focusing on, and I'll try to put it in monetary terms to the greatest extent possible. So, as I'm sure you're all intimately aware, it's obviously critically important to ensure that the right individuals are serving as REP Payees, determine whether or not the need exists for a REP Payee, and then conduct ongoing monitoring of those REP Payees. But obviously that's it requires resources. It requires time on the part of the agency. It requires money. And that's where I think, at least from our perspective, information sharing between the Social Security Administration on the one hand and state courts in particular on the other hand can be very, very valuable. I think it's an area where it's really a win-win, where there can be a more efficient deployment of resources than what previously exists. So to just sort of elaborate on that point, as we were doing our research and, the excellent report by Keister and Wood really kind of, I think, hit on this point as well as past work of GAO. And there's really not a lot of information sharing that takes place, even though on the one hand, the Social Security Administration is determining essentially a REP Payee suitability to serve as a fiduciary to manage some aspect of somebody's assets. And then the state courts are doing more or less the same thing when appointing a guardian or conservator. Obviously, it's a different pool of money, but the basic inquiry is essentially the same. Does the person need a representative? If so, who is best positioned to serve as that representative? And then over time, is this person continuing to be qualified as a representative? And, as that process plays out, oftentimes information will become available to SSA that would be relevant for the state courts to know about, and information will become available to the state courts that is relevant for SSA to know about. and ensuring that they can share that information in the most seamless way possible really has major efficiency implications in terms of allowing both the state courts and SSA to deploy their resources most effectively. Now, I don't want to talk for too long, so I'll wait for later. I think subsequently in the discussion, we'll be getting into some of the challenges related to that information sharing. And, just to preview that, I'd say there are any number of legal challenges and operational challenges. But from an efficiency perspective, I think it's very, very important that this be able to happen, because I think it allows SSA to use its resources much more efficiently and to really draw upon leverage a similar inquiry that's taking place at the state and local level.
So Henry? Before I march down the alphabetical order, let me mention one other area of information sharing that's only been touched on, but it's a much larger issue, and that is interagency information sharing. We've heard about VA, but that's only one of several governmental agencies that, by virtue of making cash payments to people under a variety of circumstances, confront the question of whether some oversight or assistance is necessary or desirable for the recipients. So there's the regular government pension system, the Defense Department pension system, probably a lot more I'm not thinking of right now, but I hope that somebody can address that. Somebody was about to speak and I stepped on their line.
Henry, it's Kurt Decker from NDRN.
I was going to you next, and I thought maybe you might have something to say on this.
Indeed. For people who don't know, NDRN does receive funding from Social Security under the Protections Act to conduct face-to-face reviews with beneficiaries and rep payees. We're funded to do 5,000 a year. And when you think about the fact that there are probably 8 to 10 million beneficiaries of Social Security with a rep payee, that's a drop in the bucket. So obviously, I would say our work around the states and territories pretty much confirm a lot of the research that was discussed earlier. And so we can certainly see in our work sort of a parallel track of what was identified. Clearly, we believe that more monitoring needs to happen. Even if we were to meet our 5,000 goal, we would not be seeing that many people. One of the things we identified is that even though Social Security believes that they do training of rep payees, almost all of the rep payees that we talk to say they've never really received any really good training or indication of how they're supposed to do their work, even things like titling of accounts, et cetera. So obviously, more resources into training. One of the, I think, compromises or bargains that were made with the Protection Act was that Congress relieved Social Security of the burden of the individual reports from a lot of the individual payees, with the thought that that savings, anywhere from $90 to $150 million, could be put back into a more robust program of oversight and monitoring. Other than the money that comes to the protection advocacy systems, basically we haven't seen much of that funding going into that system. And as a result, the regional offices, we think, are very understaffed. We send many, many thousands of reports to the regional office that where we've identified problems, and they often sit there because there's not adequate staff at the regional office. So taking some of that savings that was anticipated in that statute, I think could go a long way to beef up not only monitoring, training, but also additional staff at Social Security.
Kurt, let me ask you a question before you go further. You have a budget. You do 5,000 reviews a year. Simple division would give you how much per examination?
The initial calculation was about $4,000 to $5,000 per review. That's a an estimate. Obviously, if the review is near our office, it's probably less. But if you have to travel 300 miles across the state of Montana to get to a nursing home or a provider, the expenses grow. So it's kind of an averaging out. We'll win some and we lose some, and the overall nature of the grants.
So 25,000, maybe 40,000 more reviews could be done if the savings realized from suspension of the annual reports were channeled into this particular source. I think that's, it may be very crude and it may even be misleading, but it is a guidance to that this doesn't come for free.
No, it does not. And of course, we have to do large congregate facilities of over 50, which was the traditional role of Social Security. They've now added, as was mentioned earlier, smaller group facilities of under 50, group homes and other ICFMRs that might be less than 50. And then, of course, they've added all the individual reviews. So we are, in many cases, going out and looking at individual payees, which is very labor intensive, tracking these people down. We find often that the numbers and the addresses that we get from Social Security are wrong, and that requires a lot of returns and follow-up. One of the benefits of the program, Congress anticipated that about 15% of our reviews could be generated by the protection and advocacy programs based on their conversations with all our other colleagues in the field. And so therefore, we are not just dependent on what Social Security identifies as a problem through their algorithm, which was, I think, mentioned earlier, but we also can nominate, if you will, places that we have heard through our work on people with disabilities to put them up as a possible review. And we have found that often those reviews generate more problems than the ones that come directly through the periodic reviews or other algorithm-based reviews from Social Security.
Okay, before we move on, just a question which came up again this morning, and I'd like to direct it to you specifically. Kurt, do you have any real understanding of what goes into the algorithm that SSA uses for suggesting reviews?
Well, we have visited with the Social Security people who've created that, because when we did the first iteration before the statute was created, we had a contract with Social Security, and we were surprised, for lack of a better word, at the fact that we weren't finding a lot of, which is good. I mean, I always say this program is good news and good news. The good news is 80% of what we see, there's not a problem, thank goodness. But the other 20% are a problem, and we get a chance to identify that. And so I hope, for those people who, people in Social Security who might be annoyed that they were forced to do this, it is, actually reinforcing the fact that many payees are doing a good job, but there are many, many problems that need to be addressed. And so we looked at the algorithm. We could not see, frankly, we're not technical research or scientific people. So the threads that were in that algorithm appeared to be good indications, but I really don't know how that functions.
Okay, let's move on then to Ed Doonan from the National Association of Organizational Rep Payees.
Good morning. Thank you for inviting me, and thanks, Kurt, for some of the things that that you talked about. I think one of the things that is a concern for our members is that there's a lack of consistency through the entire Social Security system, from the top all the way down to the local offices. Sometimes one of our members will go into a local office with, let's say, 3 different issues, and they'll end up talking to 3 different people and get 3 different answers, yet it's the same issue. And that's very frustrating. Speaking to what Kurt was talking about, one of the things with our association is we've developed what we are calling best practices for our members to be able to follow, so that when the reviewer does come to look at that particular program, we're able to work our way through it and generally come up with a pretty good report. I liked what Kurt said, that 80% of the cases that they have, they find that there isn't any problems. And so one of the things that we're concerned about is that Social Security, for one reason or another, has fee-for-service agencies on their highest priority for reviews. We, of course, represent a lot of fee-for-service agencies, and so we look at it a little bit differently. We also see, particularly in California and other places, that there's a lot of vendors that are payees. in San Francisco, a vendor can be a housing provider. If the tenant, the beneficiary, acts out and they get evicted from their housing, then they terminate their payee service. Then the only payee service that's available is a fee for service, which creates a tremendous toxic environment. So I think one of the things that we would recommend is that they take a look at how they decide who is going to be reviewed. And I would support what Kirk is saying, that they need to be able to have a lot more reviews.
Kate Lang, Justice and Aging.
Thanks, Henry. I won't repeat what folks have already said, other than that I support what points folks have made, and in the interest of offering something novel, I wanted to offer support for SSA putting some resources towards improving its own internal system. We heard in the report about there being inconsistencies about decisions being documented by SSA employees. So I think that that system needs to be improved to make it easier for SSA employees to document their decisions. And I think also it would be beneficial for employees in the local offices to be able to see what were the results of these reviews being done by the P&As when they are making a decision. So if the internal Social Security system could be enhanced to allow them to see that information as well, I think that could be very beneficial.
Henry, I hate to jump the line, but Kate reminded me, we have one area where Social Security, I think, needs to improve. We have been instrumental in closing down several large fee-for-service entities, which we felt was important because of what we uncovered and Social Security acted. What we then found was 1,000 folks lost their payee, or 1,500, and we weren't sure that, frankly, that Social Security had a good mechanism to track what happened to those people. We began to, my program started getting calls from Adult Protective Services, legal services, saying some of these folks were wandering into their office saying, I'm not getting my benefits, I don't have a payee anymore. So we don't want to be the catalyst for putting people in more jeopardy in our efforts to try to protect them from a fee-for-service program that isn't performing at the adequate level.
This came up this morning, of course, in the observation that there was a tension between the evaluation of whether a person needs a payee and whether a payee is actually available. And that in some cases, people were being adjudged capable of handling their own funds when that was questionable because a payee was not available to assist them. You're suggesting that in many cases, in some cases at least, because payees are doing a lousy job or even a dishonest job, they need to be fired. But once again, there's a tension, which the examples you just described highlight.
I want to, I can't believe I'm just going to disagree with Bob Jundev, my longstanding friend and colleague, but I think he said something this morning about could the P&As be helpful in looking at whether someone needs a beneficiary. We as a civil rights organization do believe that structurally representative payees is a diminution of a person's rights, and we certainly endorse everything that Judge Glenn has said. So we would not be involved in helping Social Security find a new payee. Our job is to find problems and let them know that something has to change there.
Okay, moving on, Kathy Laren from GAO. Would you have something to say on this issue of priorities of where resources should go?
Yeah, thank you. I'm coming at this from the perspective of a body of work that GAO has done over the years, not just on rep payees, but also on preventing the financial exploitation of incapacitated adults more broadly, including by guardians. We've done a number of reports in this area, and the one recommendation that has come out of that is consistent with what Reeve was talking about earlier, which is for SSA to coordinate and share information with the state court system. But stepping back from that a little bit more broadly, I think that if you look at our work, what it really emphasizes is that when you're talking about oversight in an era of scarce resources, it's really critical to leverage other entities that are doing similar or overlapping purposes, which is to protect incapacitated adults. And the court system, of course, is the main one that comes to mind, and that's why our recommendation focused on that. But I was really glad to see that the ACUS report both reiterated the recommendation to improve communication with the court system, but also brought in the long-term care ombudsman program and coordination with that as well, because you know, when we were looking at best practices, not just at the federal level, but also at the state and local level, really where we saw the best practices come out is where there was more of this information sharing and coordination between the multiple entities that are in place to protect the rights of older adults and, you know, including Social Security beneficiaries. And, you know, just one other thing I would add following on the comments of the keynote speaker today is that, you know, we highlighted the fact that better coordination across these entities not only resulted in preventing elder abuse and financial exploitation and improving protections, but also in developing models that are less restrictive than guardianship.
And what form would those be?
You know, I think that these are, oh gosh, models where people, I think just some of what has already been talked about today, where there is assistance in decision-making without taking over the decision-making.
All right, let's maybe we could develop this a bit, because, and this in a way will be impinging on the third session. But the point has been made, I guess it was during the keynote, about what Social Security Administration's primary task is. In short, it's to get a check for the right amount to the right person on a timely basis. And with respect to the use of those funds, the bedrock requirement is that they be received and not be subject to fraud. But beyond that, the question I have is, if people, any of those who are participating, including especially the researchers, organizationally, where within the Social Security Administration would this these additional functions be lodged? How do you layer into an organization whose purpose is check writing and delivery without mistakes and promptly, the provision of this graduated support? I'm at a loss, frankly, as to what the answer to that question is. And the question, the answer shouldn't be limited to the people who've spoken so far. Anybody who has access here, I guess I would direct it to, especially to Pamela Teaster and Erica Wood, who just completed the admirable study that they presented this morning. Do you have any thoughts on that question?
Go ahead, Pam. I'll follow.
Okay, either way is fine. So I want to place one suggestion, because we've said it a lot. It would be, I think, an avenue for some of that would be with the training that could occur. That we keep saying, not just the staff, but the training that needs to happen for the representative payees, because I think that could be fed into that without adding an additional huge job duty or position. But I believe some of the problems that occur is that Erica and I found, Erica, you can say if I'm wrong, but we were astounded at the lack of communication or knowledge of outside entities that could support their work. Like we were surprised that so many people never heard of an area agency on aging, and they just had never heard of it, or they hadn't heard of a long-term care ombudsman, or they really didn't have any interface with APS. And so I know this is about communication, but I also think it's about in the training endeavor, that's where it could enter in. Eric, I'll let you go on.
Yeah, just to build on that and follow on, I think that building bridges with the Aging and Disability Network, and by that I mean national, state, local, but particularly state and particularly local. Where are the supports? They're in the local area agency on aging, the local social services office, adult protective services, all kinds of local agencies, both for older persons and for persons with disabilities. That building of that bridge, I think, if we had kind of a slimmed down but robust payee program that had these kinds of connections and bridges, I think could be at least one building block.
And Henry, if I could jump in again, one hallmark, I think, of our program, and it's not the answer totally, is that because of the knowledge that the protection and advocacy system has as a cross-disability program of the other services in the community, when we go in, primarily to do a financial review, we then look at the conditions that the beneficiaries has, and we're able to make many, many referrals. Sometimes within our agency, we have people who tell us they'd like to go to work. People who like to get rid of their rep payee. We do that kind of work in our other programs. And then we also refer out to licensing agencies, housing agencies, OSHA, adult protective services, a whole variety of agencies in the community that we have worked with for years to say we have found a problem. Now, without Social Security is very clear they're not a social services agency, and I'm not so sure we should make them into that. But we can't just, as I say often, we don't walk into a payee's office, step over a dead body and ask them what's in their books. We have to look at what is going on in that agency beyond just the payments and the management of the money.
Henry.
Yes, please, Lou. I was going to ask you.
Yeah, I think you touched an interesting question, and I think we may discuss it more in our panel, but I think you're right. Social Security is never going to get the staff to adequately do this. They're going to have to get help by agreements, by contracting some way, but they need to have a core of people who will oversee the contract or the agreements, and small core of people who understand this area and can oversee it in a way that ensures that what's being done is being done adequately, properly, and to coordinate with some of these agencies at a national level and perhaps pass that down to a regional level. But I think we can all agree that they're never going to get the kind of staff they need in the local offices to handle these kinds of issues.
Go ahead, whoever was about to speak.
Henry, thank you. I agree that the training is a big issue for both payees and for the Social Security Administration. But typically form follows function. And one of the things with the Social Security Administration, it was originally started for providing benefits for people that worked a certain amount of time and retired. That's pretty straightforward. Once we started now then having a needs-based program, it requires significant more training, and we believe that it ought to also include specialized folks within the Social Security Administration. We find that there's so many inconsistencies in within a given office because the staff isn't even aware of what the issues are. And then, again, talking about Kurt's ability to be able to do reviews, sometimes they can do a review and it takes over a year to get the results of it, because it then goes back. Once Kurt's folks do the review, it then goes back to the Social Security Administration for whatever review they do, and then oftentimes the payee agency isn't informed about the findings for perhaps a year or more.
Ken, you turned your picture on, which makes me think you might have something to say.
Yeah, the reinforcing what Lou said, the potential for vast added resources seems unlikely. And that's not just true inside the agency, but for whatever these functions are going to be. In other words, how the resources are going to be managed, given the limited amount of resources that the agency has. And there's been a multi-decade underfunding of the Social Security Administration, and that's led to some real challenges for the agency to be able to do work. That all said, if we look at as mission has expanded, the agency struggles but finds ways to meet those missions. We think about that retirement system that was just talked about, the disability system that came in, then the SSI program came in. That took substantial culture changes within the agency to try to figure out how to address these issues. Rep Payee, now this may be on the verge of another culture change potentially. If work can be done about trying to sort through how to best manage that new collaborative process. But I remain deeply admiring of the people that work in the agency to try to make it happen as missions change. That all said, it's also within the context of the fact that there just aren't a heck of a lot of major resources that have been forthcoming in the past. And I'm not sure there's going to be a massive amount of new resources. So that's going to take some creative thinking by the agency, by the Congress, to try to figure out how to make that happen.
Are there any additional comments on this before I do a segue?
Henry, maybe I could just add one small thing. For payees and for the Social Security Administration, a tremendous amount of their efforts has to deal with managing the resource limits that beneficiaries have. The resource limit at $2,000, if you are a payee organization and you're trying to save a little bit of money for the beneficiary to be able to get into housing, you're going to be over the resource limit pretty quickly. Then that involves the Social Security Administration. The resource limit was established in 1989. And so it would seem to me that the board and others of us could advocate to have that resource limit changed. And if you just did it by inflation, it should be up around $5,000 or $6,000. And so if the person was able to keep assets up to that, they're not going to become rich, but at least you'd be able to have enough money to be able to get them into housing, and you'd be able to do some other things, and you wouldn't be constantly bumping up against that $2,000 limit. Thank you.
As an aside, this is an issue that has received some discussion inside the board. And without going into details, I have to report that we weren't able to come to agreement on the issue you have just raised. That said, Nancy Altman exercised a right of each member of the Social Security Advisory Board, and as an individual member, included a call for exactly what you have suggested as part of an annual statement that SSAB is authorized to include in a report of the Social Security Administration. So if you're interested in pursuing that, staff can give you the exact, anyone on this call can give you the exact reference to what Nancy wrote. Further comments along the same lines on the issues that the two past commissioners just raised?
Again, Henry, this is Kurt. I do think they did make an exception around the stimulus checks, that would not hurt someone's income level. Problem with the stimulus checks is, again, Social Security feels that's an IRS issue. And when we raise the issue about what are you doing with payees who are receiving this money on behalf of beneficiaries, we basically got, well, that's not our problem. So we, in our reviews, have been looking as to how those payees are distributing those stimulus checks. And there's some serious issues when people in nursing homes and other places, folks in group homes are not being allowed to leave due to COVID. And so how people can actually expend that money, even if they're getting it. So again, this is another argument for why there has to be some external way of addressing all of the issues that beneficiaries see as a result of having a payee. And again, I don't believe it's necessarily appropriate for Social Security to do that, but they do have to have a place to go to do that. One of the other things we are
Kurt, I just wanted to kind of jump in here. It's Hillary from ACL. Hi, everybody. I was going to wait until the third panel, but this seems to call for just a little bit of a response. And I probably will address it a little bit more in that last panel. But a correct understanding of the rules around the entitlements benefits, most specifically Medicaid, and related to all income and assets, because it wasn't an exception for the economic impact.
Could you move closer to your microphone? You're fading a bit.
Sorry. Can you hear me now?
Yes.
Okay, I'm so sorry. There are longstanding rules that govern how income and resources are treated. So it wasn't just an exception for the recent economic impact payments, but this goes to a need for everybody in this system to have a solid understanding of what those rules are and what funds are counted and not counted towards income and asset caps of any kind. I would say, with regard to the economic impact payments specifically, that there obviously were some questions, some really serious questions when Social Security clarified that because the economic impact payments are not a Social Security benefit, that accordingly rep payees should not be involved in assisting beneficiaries with how those funds are spent. With assistance from our National Center on Law and Elder Rights at Justice and Aging, we produced an easy to read flyer, FAQ flyer, and I will do my best with my limited technological skills to put a link to that into the chat. But there are answers to all of these questions. They're not always what we want, but very often they are in supporting people making decisions about how funds can be spent.
Thank you.
I'll shut up now. and I'm
Please
sorry,
don't.
Kurt, for interrupting, but.
No, it was quite apt. Let me just say at this point, I think that this crisis, the COVID crisis, in one sense was predictable and predicted. And For that reason, perhaps we should in various ways have been prepared, but weren't. But it was also a brutal surprise. The next time this sort of thing happens, and there will be a next time, there is no justification for not resolving these kinds of administrative questions in advance. Having contingency plans for how supplemental financial aid will be distributed and supervised, for example. There's no reason why intelligent administrators cannot anticipate at least many of the questions that have arisen during this crisis and do some thinking in advance. And one hopes that once we've gotten beyond this crisis, that kind of advanced thinking will occur. It's really—
And Henry, there's another issue here. Even though we were limited in the types of reviews we could do during this COVID period, we made many, many phone calls to many facilities. And what we discovered, again, under the auspices of the Social Security Monitoring Program, that many group homes for people with disabilities were not getting PPE or testing. We found in Georgia, for example, that they had rules about nursing homes, but did not cover facilities for people with disabilities. And we were able to change some of those policies because we were able to identify those problems. In Florida, again, health departments understood going to a nursing home and an assisted living center, but did not go to the ARC group home where people with more serious disabilities were living and not getting access to PPE or testing.
I'd like to do a segue here, as I mentioned a while back, to a different set of questions. And they revolve around what has been referred to as the dynamic character of the needs for rep payees, going in both directions. People who have needed them in the past no longer need them, or people who have not needed them in the past now do, leaving aside what need means and whether it gives access to, whether you're going into rep payee status or some kind of graduated assistance. Let's leave that aside. The problem is identifying these transitions. Now, so my question to anyone is to come up with administratively feasible ways of doing that identification, of identifying transitions in a way that is not excessively costly. And as a corollary to that question, we have a number of research centers funded by the Social Security Administration, scattered around the United States, very highly reputed. National Bureau of Economic Research, Boston College, University of Michigan. I'm leaving somebody out who, University of Wisconsin. If you were giving these research centers advice on how to tackle the question I just posed or others that you think are important for the rep payee program, what would they be? What would you tell them to do? How could these research centers help to answer the kinds of questions that have been posed here today? These are two very different questions. I perhaps shouldn't have lumped them together, but I'd like to see if there's any reactions or thoughts on how. Let's start with the administrative question of how, in a practical fashion, could we identify transitions in need for rep payees? I'll call on somebody specifically if nobody speaks up. Well, as
I'll speak up, Henry.
Please do, before I call on someone.
The transition from whether a person needs a payee or doesn't need a payee is significant. And one of the things that I've observed is that we've had a tremendous increase in the homeless population prior to COVID even though employment is very high. And one of the things that we have seen in California is that if a person is collecting SSI, they get $1,000 a month from SSI plus $200 a month in food stamps. And then if they become housed in a supportive living arrangement, they then get their benefits cut by a third. And so in Sacramento, you can camp on the side of the American River and get your $1,000. If they house you in a supportive living arrangement, you lose $300. And so I think that one of the things that they could research was that if a person is homeless, they shouldn't perhaps receive the housing allowance that they would lose if they become housed. And so that's just a kind of a 30,000 foot view of it, but that's one of the things that we've observed is that a lot of times people don't want to get housed, and so that's their choice.
How do they receive their payments?
Typically either through a check, or they get perhaps they get a debit card from I can't remember, the Direct Express. But in any event, they don't have to go to the Social Security office. And again, they're receiving. It's kind of unfair to the person who then gets housed in supportive housing and loses their income, and they lose a third of their income, and the person that is homeless doesn't lose that amount.
So from an administrative standpoint, what you're saying is if the mode of payment, perhaps the address to which the check is sent, changes, is that an occasion for precipitating a re-examination of the need for a rep payee?
Well, currently, payee organizations are required to advise the Social Security Administration about whatever their living arrangement is, and they have a scale as to how much benefits they get based on their living arrangement. And I'm suggesting that if their living arrangement is, it's technically categorized as not having kitchen facilities, but in actuality, that's the homeless rate. If a person's getting the homeless rate, their benefits should be cut by a third, and that's just an administrative procedure.
Either Erica or Pamela, do you have any thoughts about how, as a practical matter, one could identify transitions?
I don't, but I recall that throughout the day there were a number of transitions specifically named: the redetermination process, the change of payee. We must have named off 5 or 6 of them, which would be a base on which to build. And I would think that such a research entity could start there and research what other transitions there are, and then a protocol for what to do when those are identified. But I know it's not that simple.
Well, it's a place to start.
But Henry, I guess I would like to say, I guess I'd rather come down on the side of increasing benefits, not reducing them.
Well, that's the benefit amount. Actually, I think Ed was giving an important answer to a different question from the one I asked. He was answering under what circumstances should the payment amount be changed. And you guys can find out whether it goes up or down. I was looking to see whether changes in payment status could serve as a trigger for examining whether or not a person needs a rep payee or should have one. Lou, you're leaning forward. You're also muted. You're still muted.
How's that?
Good.
Finally, third try it happened. No, I had in mind when I read the report and heard some of these recommendations that these resource centers be tasked with taking up some of these issues. And I must say, at one point I was appointed some kind of advisor to one of these groups. And there are 2 points. One, SSA cannot direct what they do. They very much resent even being suggested what they do. They like to come up with their own ideas. And secondly, they don't get into administrative issues. So I think if you word the question in the way that it can be true research, we might be able to do something with that. But there's a tremendous capacity there to take some of these questions that have been raised today and develop them. And obviously there will be more come out.
Well, this is another issue that he has discussed at some length. I'm a strong believer that administrative procedures can be the subject for very high quality research, and indeed call for very high quality research in many cases. So I think it's a mistake for the academic entities, if they do, to disdain administrative questions as a limited, as an area for research. But that's a pet peeve of my own. Are there other thoughts here on either of the 2 questions that I posed?
Yeah. This is Kathy with GAO. I just wanted to add that the point made earlier about sharing information with the court system certainly wouldn't replace an administrative or regular mechanism, but it is something that could help with this issue, because the courts themselves are also assessing people's capabilities, and to the extent that they have information that they could share with SSA in making those determinations, it's just another benefit to that information sharing if it could be more regular.
As Catherine knows, as Erica does, and I guess so many of you on the call, here's a low-hanging fruit thought. Every jurisdiction requires that, just for guardians, this would be one way, but every jurisdiction requires that guardians submit an annual report, right? Now, whether they read them or not, Catherine, that's a whole different ballgame. But they are required guardians are required to submit them. Here's one way to get some information about some representative payees and the people who are also their guardians. Why can't there be a checkbox on an annual report that says that the guardian is also the rep payee? Then you'd have actually some information about the person. And there could be some research work to do. And that would get you at an individual level, because the jurisdiction could allow you, a researcher, to look at it. Oftentimes, on the research side of the house that I live, getting access to data can take years.
I just need to interject. I don't know if any of you have ever tried to exchange information with courts. It's one of the most cumbersome and filled with all kinds of restraints issues that I've ever dealt with. We tried when I was at the agency to get some agreements to exchange information. Very, very limited.
That also, I think, applies to the exchange of information across agencies that I raised earlier. The rules governing the distribution of data seem to be quite different, or somewhat different at least, for Social Security from what they are at other agencies. Social Security seems to be perhaps almost uniquely sensitive to the leakage of information. Lou or Ken, did you have any experience as far as the issue of information exchange across agencies from your experience as commissioners?
I think the only way that substantially larger amounts of information will be shared is if there's an administration-wide and possibly congressionally authorized framework to enable that. But I don't think typical intergovernmental relations, intergovernmental memorandums are going to solve that. So if the board and then ultimately Social Security starts to think about deeper ways to do information sharing, it's going to take one, government-wide direction, and two, it may very well take some law changes as well, because Social Security, there's a tremendous reluctance in IRS and Social Security for sharing beneficiary information and cash information. So one, the work's got to get done about what makes sense to share. Two, cross-government direction, probably OMB led. And three, very well need law changes. So a real rationale needs to be developed, it seems to me.
This is Kurt Decker again. I would second all of that. If it's Star Trek fans, I always see Social Security as the Borg, almost impossible to get information into them. One of our other programs funded by Social Security, which is a return to work program, we find people trying to get their income data to Social Security. They can't, it isn't accepted. They can't seem to deal with it. And then that person gets an overpayment. And we spend a lot of energy trying to get overpayments. And it's similar with payee information. We've had comments from state troopers, courts, adult protective services telling us they've tried over and over again to alert Social Security to a problem, even deaths, not being able to get Social Security to be able to absorb that information.
I want to get back to what Ken said, if I can. I agree with him that having a national approach or an administration-wide approach, even legislation, but a memorandum of understanding between the agencies can help to provoke someone to go to Congress and get changes. I recall dealing with IRS, and when we came forward with a memorandum of understanding, we were able to get ways and means to make a few changes in law that allowed exchanges that hadn't been allowed in the past. It's not easy, but it can be done, and maybe a memorandum of understanding between the agencies works. With the courts, it's a question of you have to almost do it on an individual basis with each state court, and that makes it more difficult, I believe.
Could we have Reeve maybe comment on this from ACUS, because they've done a lot of work looking at this in terms of identifying those key barriers. I know the Privacy Act plays a big role as well.
Absolutely, would love to jump in. Thanks, Kim. So that was probably the key issue in our study that we released earlier this year. I would echo what everybody said in terms of, I think SSA takes perhaps a uniquely restrictive approach in terms of how they interpret the law. So the key law here, as Kim indicates, is the Privacy Act. And I think part of the problem here is the Privacy Act, it almost certainly would apply to sharing of information, either particularly with state courts. There's of course what's called the routine use exception, which would be the most likely exception to apply here. But the problem is, and this is what we really got into with our research, is the case law is very unclear in this area. Basically, under the routine use exception, an agency is permitted to share information with another entity if the use of the information is compatible. It's the term that's used. And what that means is relatively unclear in the case law. It's clear that it doesn't have to be an identical purpose. And it's clear if the purposes are fundamentally different, then that's not permissible. So there was a case, for instance, where information was collected to determine somebody's suitability for employment. And then the question was, could that be shared with a prosecuting entity? And the court decided no, those uses are sufficiently different. One is an employment context, the other is in a criminal context, so that's not a routine use. There's no case to have actually adjudicated whether or not SSA sharing of information would be compatible. In our report, we argued that you could make the very strong argument that it is. So especially with state and local governments, and of course the same thing is true with sharing with other agencies. you know, in the context of a payee decision, you know, basically SSA is reviewing to determine whether or not somebody's qualified to manage somebody else's assets to serve as a fiduciary. And with respect to the state courts and their guardian conservator decisions, it's a very similar function. They're basically using the information to determine is this person suitable to serve as a guardian or a conservator. So I think you can make a very, very strong argument that routine use exception is met in this case. But unfortunately, the case law is very sparse. And I think that's the reason why SSA has taken traditionally the position that it has, that it feels it would run a litigation risk if it were to share that information. Now, we recommended that SSA seek an opinion from the Office of Legal Counsel to provide it some cover here if it were to decide to do this. I think Lou and others have discussed the idea of an actual statutory change, and you know there have been instances where Congress does provide an actual exception to the Privacy Act for a particular type of information sharing. That obviously would get the most cover here. But you know, if you just look at sort of the case law itself as it currently stands, it's not an unreasonable argument that SSA is making that you know, arguably these are not sufficiently compatible uses to meet that exception. Though I think a strong argument could be made that in fact they are compatible.
I just wanted to mention quickly, Henry, that you know, a challenge has always been in the Congress that the Privacy Act is a separate jurisdiction from the committees of jurisdiction who have oversight over Social Security. So as Ken and Lou pointed to, kind of that it's really going to take a groundswell to get, you know, committees don't coordinate on a good day, never mind, you know, addressing other issues like this. So it'll be a real challenge.
Let me be specific on this. Oh, go ahead, Pam.
So I want to press a little bit of I understand the challenges that there are to getting SSA data, and probably of anybody on this call, there isn't probably anybody who'd be more happy to have that than I. But having said that, I would like to ask Laura to talk about something she and I have both done, and that and analogize to the Centers for Medicare and Medicaid Services, where it is possible for researchers to get PII information because there's a process in place. I'm not saying SSA has it, but I think it's instructive because both me on a national sex abuse study and she has on patient outcomes have worked with that entity to actually go around that problem. It's doable. So I know Laura's on the call, so I'm going to ask her if she'll speak up here a little bit because she has worked on that more more than I have, although I have as well.
This is Laura Sands, and I've been working with CMS for probably 15 years and accessing patient data for the purposes of evaluating programs. For example, one of the programs that I'm particularly interested in is Home and Community-Based Services, the 1915C waiver. And so I use their health utilization data to understand how amount of services, interruption in services affect their future health outcomes. So why would they give me these data? First of all, CMS has been interested in process improvement for ages. So they do allow researchers to use data in the context of process improvement type research. And so just as was stated earlier by Mr. Ball, there is a memorandum of understanding between the university and the agency for me to be able to actually access these data. That's the first thing. There is also something called a data use agreement, and just an amusing sidebar on that. After writing 46 single-space pages about how we're going to handle the data to ensure privacy of information and make sure that it is not, there's no access to that data other than by those who are stated in the data use agreement. After 46 pages, there was a small thing at the bottom saying Paperwork Reduction Act was considered in writing these forms. So the point being is that there are in other agencies processes available that have been working very well with regards to using private information in a way to do process improvement studies of real outcomes. And I understand how important that is because whereas this project that we did was much more about processes and procedures from the perspective of those who are selecting rep payees, we really don't know about the payees' outcomes. And so that's a very different study. So there's precedence, but my precedence is in the CMS realm. And we, as I said, all data are handled in a very careful way that has been explained to CMS such that there is no way that there could be any misuse of data. It's only for the purposes of reporting outcomes.
If I can add to that, CMS has special legislation for research purposes to allow their data to be used under certain circumstances, and I'm almost certain that's what Laura is using. That's been in existence probably about 20 years.
Right.
It's a special legislative opportunity.
Could I follow on some of this, and I'd particularly like to ask Reeve to talk a little bit about the communications between SSA and the state courts more on a policy level. So here we're not talking about data exchanges and security and the Privacy Act, but rather one recommendation in the ACUS report that I found very interesting was that there should be mechanisms for two-way communication from the top, or at least from the regional level, with state court leadership to on just general policies, procedures, and so on. Now, that's not going to solve the data exchange, but it's still very important.
Sure, happy to weigh in on that point. So no, I echo everything you said. I think that you know, that in and of itself would be quite valuable. You know, we looked at it specifically in the context of trying to structure some sort of arrangement by which additional data sharing could take place. So, you know, yeah, anytime you are sharing individualized information, then the Privacy Act is implicated. But in terms of sort of these broader efforts to share policy information or to coordinate on broader issues, I think that's right, that generally, you know, it would be at a somewhat higher level, you know, rather with individual state courts, you know, with entities within the state government. But that in and of itself can be quite valuable and does not implicate, yeah, these same Privacy Act issues that sharing PII, personal information, would implicate.
What about sharing of information within the federal government itself? Say between the Defense Department and Social Security, when people receive both a military retirement check and a Social Security check, as many people do. This is intra-federal government. I fully take Kim's observation about the difficulty of cross-agency agreements. But if one could get people high up in each agency to say, hey, this is something we really ought to do with respect to representative payee functions. Both of our agencies have them with respect to people who are not able to manage their own funds. Why should we have duplication here? Let's set up a set of protocols and give precedence to one agency to handle the management of both funds. Why is that so difficult to do? Ken's going to tell us why.
It's going to be difficult to do unless both agencies really think that this is important to be thought of cross-government wide. It seems to me that the key, if the SSAB is going to be looking towards recommending government-wide solutions, you got to be looking to OMB to provide a government-wide framework to be able to deal with Office of Personnel Management, with the Defense Department, with the Veterans Administration, and And without that, I think that its potential to be successful is fairly slim. This is not at all. This has got nothing to do with partisan. This is this whole issue is a seems to me fundamentally is a nonpartisan issue. It's an improvement in service delivery to a growing proportion of people. So there are large parts of OMB that are clearly not at all focused on the politics of things or have an ideological bent. Right. I think that the SSAB is in a really good position if you could find a couple of other partners to migrate this to help force or encourage OMB to do a government-wide activity. Without it, I think you're not going to get very far.
I agree with Ken. The only other issue that is involved here in interagency is the timeliness. If you're talking about getting data timely, one of the biggest problems in overpayments is the agency's inability to exchange the information timely about different benefit structures that cause overpayment. So if you get OMB to agree to some kind of an activity, there needs to be some funds to put together some mechanism that gets timely information transferred from one agency to the other.
If there are no further observations on this, I'm going to do what people sometimes do in Congress, which is to say, I cede the remainder of my time, only it's our time in this case, to the honorable gentleman from Oregon, Bob Jundeff, who will be moderating the third session, which involves policy looking ahead. I think this session has been quite useful, although in many ways frustrating for reasons I think encapsulated by what Ken just said to us. But I think we have been already treading a bit on the topics that the third session is meant to address head on. And so I am going to suggest Kim, Claire, Diane, and the real power in this operation, Conway, that we move from here to the third session. I don't know whether, Kim, you want to intercede at this point.
No, I think that's a fine idea. The only thing I will say is at the end of your session was a 15-minute break, and perhaps some of our folks might have been looking forward to that break. So perhaps what we can do is just go ahead and take that now and reconvene at 2:30 and just start Bob's panel just about 15 minutes earlier, which I think would work great.
Thank you.
Okay, everyone, 2:30.
Right. Well, this is our last panel of the day. Hi, everybody. Bob Jundeff again for the board. And I was tickled to see that Henry handed this off to me because when we were talking about who should be moderating which panel, Henry and I had an electronic arm wrestle for this one because we were both very much interested in this topic, and we think panelists are as well, since we have 10 of them, really. And so this is about the question of should Social Security be in this business at all? And the way that I would frame the question is as follows, and whether this is fair or not, you can let me know. Social Security, in my view, does a marvelous job in moving money out to human beings. About $1 trillion, an enormous amount of money every year. And it has every interest in the world in making sure that that money gets to who it is supposed to get to. But a question really arises as to should its responsibility be after that? Once that check is gone out of the building, what does it have any further responsibility to the folks who receive it? And is it really equipped to take an interest in that? Now, speaking as a lawyer, I can imagine as any entity that's moving money out, that you want to make sure it gets to where it's supposed to get, and that any knowledge you have that might indicate that that's not happening, you might bear some level of responsibility. But what about the question of whether that money is being used actually for the purposes for which it is being allocated? And is the person receiving it actually getting the benefit of that money? And those are really some of the questions that we want to talk about today. We, as I said, we have a fantastic group of folks who can tell us their views on the topic. I'd like to start by just calling out individuals to speak to those issues, which are basically another way to look at it would be, if Social Security is going to continue to do the role that it's doing now, are there changes that could be made so that it does that better? Or should we be thinking about another way to do it? And so I'll start out with Commissioner Ken Apfel. Ken, are you ready to go?
I guess I will be ready to go. Fundamentally, Social Security is the most important anti-poverty program in the country's history. I mean, it's the fabric of our country. So it is hugely effective at what it does. Given with all the challenges that it faces, hugely successful in terms of impact on people. It is mostly an on-off agency. Is someone eligible for retirement? Is someone going to be eligible for disability? Does a person's income and this disabling condition make that person eligible for the SSI program? Does a very poor child with major disabling conditions become qualified for the SSI kids program and for ancillary Medicaid services? It's an on-off agency. It's not a service delivery agency. And it has been established that way since the very beginning, so that there's not a lot of discretion to say, that person is really needy. Can we just get them an extra couple $100? That's not the way the system works. So it's not a traditional service delivery agency, no doubt. And the areas that it has some of its largest struggles, say, would be return to work is one. I think Rep Payee could be another, where there's more of a gray area to try to figure out how to intervene and how to intervene appropriately. It seems to me that if this agency, or if the nation believes that we need to move away from an on-off framework on, say, Rep Payee, more of a greater focus on supportive decision-making and what have you, that's going to take the agency having to step into a role that would be bigger and tougher than they've faced up until now on Rep Payee. I don't see how, and I think we'll go on this, I'm sure, for other questions, so I'm not going to rattle off a bunch of other things, but Social Security definitely needs to play a role here, and it must. These are its beneficiaries. And what I hope we'll talk about is how it could and how the rest of government maybe could, as we come closer to thinking about how to change the definitions about how we're going to provide help for individuals with significant disabling conditions. So that's my quick answer. I'll be back later.
Great. Hillary Dolan, next up.
You're muted.
I'm being muted.
Maybe a muting factor here.
Actually, could you call on somebody else? And what I'm going to do is switch my speakers. I'm going to switch my speakers so that it'll be easier to hear me. Can you call on someone else?
I certainly
first?
can.
Sorry, I meant to do that before.
No problem. Judge Glenn,
Yes.
please.
So I'm going to engage in the virtue of creative resolve and use a human rights perspective and focus on one of the slides that wasn't all that important to anybody else, but the notion that human rights are interrelated and interconnected. And so you have to have all of them, and different parts of the government are responsible for different parts of them, but they are all related. And although I realize that this is exceedingly unlikely, especially at this historic moment, encouraging us to work through the virtue of creative resolve. This is the conversation among agencies. This is, how do we ensure the human rights of people, given what each of our tasks are. Yours is to get enough money to people who are disabled to enable them to live. Other folks, Hillary and HHS, have other obligations. DOE has obligations, and that's like an area that I want to talk about later when we talk about what might be some interesting solutions. But it's not that SSA has to do it all, but SSA has to talk to other people, and other people have to understand how these things are connected. And I think also from a very practical and pragmatic way, because in New York, we're now in the process of trying to persuade our legislature why they should spend, $2.5 million a year to create a sort of infrastructure for supported decision-making. It would save money in New York to do things the right way. And I don't know, and I didn't see in this report, but I'll bet there's all kinds of stuff about cost to the rep payee program and what happens when somebody wants to get out, or the cost to the program when there's, a bad payee, or the person is cheated out of their benefits, or having to do the capability determinations in the first place, or whatever. I mean, there have to be actual ascribable costs to each of those things. And it may be that by paying more attention to the human rights of the beneficiaries, especially by getting some other agencies whose job it already is to do stuff that they should be doing, that you all might be able to save some money. Ken, you look so horrified. So
I think it's going to cost money.
Yeah, everything's going to cost money, and so do bombers and drones and all kinds of other stuff. So.
Well, money's certainly a factor, no doubt about it. I'm just going to move along for more introductory comments, and in the hope that everybody can jump in and continue a broad conversation. The next person on my list was Commissioner Enlaw.
Bob, can you hear me?
I can.
Okay, I agree with everything Ken said about the agency doing some things very well. They make payments very well. They make up and down decisions pretty well. But there are other areas where they need help and they're not equipped to handle. And he mentioned return to work. They need help in the area of vocational rehabilitation. And they need help in the area of representative payment. And I think there's help out there that can be contracted. But what SSA has to do is oversee the work that's done. And that's not always easy to do. So they need a body of experts who understand this whole area, who can oversee a group of organizations, whether they're government, non-government. There are people out there who can handle the rep payee function. I became aware of the rep payee issues in 1964 when I became a claims authorizer for the Social Security Administration. Now, disability was new, and rep payees for disability was a new thing. And then along came SSI, made it more complicated. Then along comes all of the homeless issues that we have. it just gets more and more complicated. And it's not going to get easier. It's not going to get cheaper. It's going to cost money. And so I think that they have to look at ways that they're going to bring together, and it's going to be different for different folks. We talked about segmenting the population. What you do for homeless folks is going to be a little different than what you do for institutionalized folks. What you do for a spouse who is living with another spouse who's their payee is a little different. And so I think that we need more information. First, I congratulate the board, Kim and the board, for doing this. This is the most exhaustive thing I've seen, for doing it here on where you have another couple hundred people who are getting to put eyes on some of the issues that are here that we haven't seen before. I used to think you could get the people who knew about payees and their problems and meet in the phone booth, but it's getting to be more and more people who get involved and need to be involved. And how that's done, I think you can explore ways. Henry suggested some of these research groups taking issues. I think if we could come out of this with somebody could come out of this with a group of research items that could be dealt out to these folks. There are multiple things, and we're going to have to do it one piece at a time. You know, it's like how you eat the elephant, one bite at a time. You're going to have to choose that area where we can use this assistance and try it out with that group of people where we think it will do the most good. And that's the other thing, is pilot it in some areas. You can't start off changing the whole thing. It needs to be piloted, and it may be different what you do in one region and another based on the resources that are available and within the region. So it's a great start, and let's keep going.
Okay. Hillary, let's get back to you. You told me that your sound is in place.
I think it is. Can you hear me?
Yes.
Okay, hallelujah. It's all in the question of understanding technology, which is not my strength. I need a lot of support in making decisions about technology, for sure. So thank you, everybody. I have so many notes. I almost want to hold up what I thought was a very simple outline when we started this morning, and now it looks like a piece of modern art because there's notes on notes on notes. And it's almost a little difficult to find some things that haven't been said. So I'm not really going to try to do that, because I think we have a lot of this sort of out on the table, and you know, the big questions, which I think we'll discuss a little bit in this session, but will be probably more reserved for the heavy lifting after today is over, is okay, how do we do this? We have some consensus, how do we actually do it? But I just want to start from a place that we come from at the Administration for Community Living, and I think most of us come from the same place, of valuing autonomy and self-determination for all adults, looking at every individual as just that, an individual. No two of us are the same. And so the values of understanding what each person wants and desires, how they would like to be supported in their decision making, is very important, no matter what entity takes on the representative payee function. And I think we all acknowledge that this function will be necessary, but we can probably change the focus of it so that it is more looking at really who needs it. And then for those who do, as many have observed today, how long do they need it for? Some people will need it forever. Most probably, most people may be able to kind of transition in and out of needing the supports through the representative payee program. So I think the two other points I'll make, and then I'll probably have more to say later, is to emphasize what people have said all day about the importance of making these decisions from a place of knowledge and relationship of the individual beneficiary, and not on the basis of a diagnosis or a form, even a doctor's assessment, because all of us come with our own biases. but really from an individualized relationship of trust with an individual. Now that's a heavy lift, and as various people have said, it takes a lot of time. But that seems to us at ACL to be the only way to really do fiduciary relationships of any kind, including representative payees. And finally, for now, to just really emphasize the point that Erica makes, it's something we at ACL talk about all the time, which is to contextualize what's going on here. That a representative payee has one little piece of a much larger puzzle of an individual's life in a community with their family, understanding the services and supports that align to the fiscal decision making about the Social Security benefit. But there are so many things that surround that, and all of that we would say need to be taken into consideration, and we can't anymore, the way, very kind of ancient way of looking at things, to say that a rep payee can just manage that benefit and not take into consideration the whole culture and values and the world in which the individual lives. So all of those services, all of the other supporters that have been mentioned, whether it is the services that come for aging people in any event, from area agencies on aging, from nutrition programs, from the Ombudsman program, which, by the way, serves people of any age living in any congregate residential setting, legal aid, P&A, APS. There are lots and lots of corners to this world, and they all need to be integrated into our thinking about what rep payees do, how they're selected, and how beneficiaries are selected to have rep payees. And I'll stop there.
Thank you. Great framing of our need. David Liskaran, are you there?
I'm here. Can you hear me?
Yes.
I think the one thing I'd like to say is we're, at our heart, we're a transactional agency. We handle complex workloads, and the rep payee program is just one of those workloads. In my experience, and I've been with the agency for 20 years, over 20 years, 21 this year, we've always risen to the challenge when we have had to implement new legislation or policy changes, and I'm confident that we can do that. Those of us that are with the agency can rise to any challenge when it comes to changes to the payee program and be able to implement that. But part of that requires us to have the proper resources. And at the heart of it, you'll still have the employee biases so long as the program itself is subjective as to whether or not to appoint a payee. And I think that's something we should keep in mind as we go forward.
Let me ask you about the subjectivity issue. Is that since the determination of a payee is something like it's like a judicial decision in that it's removing a person's rights to manage their own money. Is there, I assume you would agree that there need to be procedures in place to make sure that that subjectivity has at least some level of uniformity. Or am I off base on that?
I would agree with that, and I think those are the kind of structures that would need to be put in place with any changes. I think there's some things that could be done now, for example, with our representative payee program, the actual technology piece of it that was discussed early this morning. One of the things that's required is we have questions that we have to ask. We have documentation that we have to put in the program itself. And one thing that would help to have a more streamlined decision process would be to have the questions that we have to ask, they should be part of the application itself, not just something that we do and have to document manually. I think that would lead to more consistency with the program.
Thanks. Ari Neiman, are you there?
I am, yes. Hi. Shall I go?
Go for it.
So I'm really glad that Commissioner Enoff raised the analogy to employment, because I think there is really a very similar dynamic between the challenges the Social Security Administration faces on administering employment programs and the challenges with respect to administering the REP Payee program, especially if we envision a shift towards supported decision-making. If you want to introduce a greater degree of nuance in administration and move beyond those binary outcomes that were discussed earlier, it is very difficult to see that meaningfully managed through a national program. And, you know, the consequences of that have been very clear over the course of many decades of efforts with regards to employment programs, where, you know, there's not only very low beneficiary awareness of things like PASS and, you know, IRWE and so on, but there's really relatively low staff level awareness of them as well. And I think it's instructive when thinking about the REP Payee program to think about how we've tried to fix that in the context of employment. You know, the ticket program, for all of its challenges, really had, I think, a fundamentally good innovation, which was to use Social Security financing to pay for services administered by local community-based organizations. When we imagine what role Social Security could play in supported decision-making, I think it could look a lot like Ticket to Work. Of course, that forces us to wrestle with the question of why Ticket to Work hasn't scaled better than it has. But I do think it's instructive to note that where Ticket has been most successful, it's because Ticket funding has been layered on top of other financing streams, you know, whether we're talking about voc rehab or Medicaid dollars or so on. And I think we would need to see something similar in the context of a supported decision-making like Ticket program, where supported decision-making as a SSA finance service you know, would conceivably be delivered by providers that are also Medicaid HCBS providers, or that are also VR providers. And as a result, not only have relevant specialized expertise that we want to tap into, but also have a stable financing stream that means that, you know, that there will be some provider network with which to work. The other point I want to make just very briefly, and I think it's connected to this transition from the traditional REP Payee program to the introduction of this distinct and possibly interrelated supported decision-making track, is whenever we talk about supported decision-making, we're really talking about two things. We're talking about improving the degree to which REP payees support the individuals that they're representing. And then the other track is creating alternatives to the REP Payee program, diverting people from, supporting people to leave the REP Payee program. I think we have to recognize that there are going to be a lot of people on the boundary of those two programs. It's not going to be very clear, you know, for whom we should be trying to divert or remove from the REP Payee program, and for whom we should be trying to improve the REP Payee program. So there's a need for a very serious conversation about how we ensure that supported decision-making doesn't just focus on how to make the REP Payee program better, but builds a meaningful alternative infrastructure so that folks who want something else can access it.
Thank you. Our last panelist is Morgan Whitlock.
Hi, Morgan Whitlatch.
Hi, sorry.
No, that's okay. You know, it's always hard being the very end, because then I'm like, oh, everybody said a lot of what my notes are here saying to say. So I think what I'll highlight, you know, I really appreciated the kind of analysis of an individualized assessment is really needed per beneficiary, one not based solely on diagnosis or some medical form, the point that Hillary made. And I think thinking through different kinds of structures as to how to make sure that it's the right people doing the representative payee management functions that exist is also a really important piece to discuss. But I think something that does need to be consistent across whoever does this, be it national or private organizations, is an overall structure that's consistent, that protects due process. That the due process elements, and I think Bob, we're talking a little bit about this, but to me it's a really important piece here. Because when I read the September report, I thought to myself about how many, saw so many parallels with many of the due process concerns raised in the National Council on Disability reports that Judge Glenn referenced in her keynote, the 2018 and 2019 reports about guardianship. And, you know, I thought to myself, oh, we have cases in which, you know, Social Security workers are not even interviewing, having in-face visit with somebody for whom they're going to appoint a representative payee if they live in a long-term care facility like a nursing home, even if it were a virtual or phone visit. That's, you know, not even allowing someone really the opportunity to have a hearing it is a concern. You know, the person should be able, themselves, beneficiaries should be part of that kind of discussion when it comes to something as important as removing their rights to make certain financial decisions on their behalf, on their own, by themselves, or with support. I think the second piece I really saw here when I thought about this was, you know, the Social Security allowing, you know, facilities like nursing homes to require that they be designated as clients' representative payees. I mean, that's a clear kind of, you know, you have to, there are conflicts of interest arise all the time, and it's about how you manage those conflicts of interest when it comes to service providers providing certain representative kind of payee services when they're paid from the person's funds. And so I think there needs to be some really strong vultures, you know, kind of focus on that. When I thought about the forms that are completed, you know, the medical forms that are completed for Social Security, and how I have worked with many people in seeking to get their I'll call it payee rights restored. Okay, so get their representative, be able to manage their own checks. And I've seen the lack of quality in those medical documents when they're filled out by the doctor, just a diagnosis listed, no explanation of less restrictive alternatives or whether or not the person can direct the management of their own funds if they can't manage it themselves. And so I think there needs to be a really hard critique of the kind of evidence that's being used to support the appointment of a representative payee. And I think that's all part of the supported decision-making discussion. Thank you.
Great, thank you. I'm just going to throw out a couple of points and see if we can get some commentary or discussion going about them. I think that what I've heard everyone say is that it would be great if we could move toward more individualization for beneficiaries. And what comes with greater individualization obviously comes more resource commitment and having to, and how one can balance between, you know, what we can do and how much it's going to cost. So I guess my question is, if we were going to take baby steps in the direction of promoting great individual assessment and supporting people to make their own decisions, what do you think the first steps would be?
Bob, could I step in here? Because something just occurred to me, which I think might help organize the response to your question. I think we've heard today 3 models of potential reform that are very different. And the first step is to choose which of those 3 models we think should be implemented. The first I'm going to call the micro approach, which is accept the basic framework of the current Rep Payee program. Recognize that there are a lot of things one could do by way of tinkering to improve its efficiency. Introduce more modern data processing, more training for rep payees, perhaps more training and different organization of Social Security staff within regional or local offices, and so on. There are many more along the same line, but basically it would be this recognizably the same rep payee program, but run better. That's one model. The second model, I think, was most clearly articulated by Lou and Enoff and Ari Naiman, which is Social Security becomes an organizer of a federalist system, the hub and quality control center to make sure that people have access to a variety of agencies in different parts of the country, nonprofits, state and local government, charitable organizations of various kinds. And Social Security uses its staff to make sure that people have access to these services and are properly serviced by them. And the third model is what one might call the government-wide approach, that the same functions exist throughout the federal government, and fundamentally what you need is some kind of a new agency that either arises through cooperation or is created under the direction of OMB to provide what is a very similar service to recipients of cash benefits from different agencies. It seems to me that the first step, if you're a policymaker thinking about this issue, is to form a judgment as to which of these three broad strategies you want to pursue. The first requires the least bureaucratic breaking of furniture. The third clearly requires the most. My sense in listening to this is that there are a number of people who would like to move in the direction of the second, but things could be made a lot better in any one of these three different directions. We just need to keep in mind what the overall strategy, if you're a policymaker, if you're working at OMB, which of these three broad approaches do you want to pursue?
Henry, I'll be glad to take a shot at that. I think it's a combination of 1 and 2. I think for a great many of the people involved, where you're talking about a person who is living with their spouse, the spouse is the payee, that a great many of those are pretty easy decisions to make. Now, there needs to be some kind of audit to make sure that that happens, or at least a sampling of some kind. And then the second part, the one point I would make, Ari and I agreed when he mentioned the ticket, in that it's not the SSA staff who actually carries out the coordination. It's through contract to people who do that coordination. SSA has to oversee it, make sure it's done right. And, okay, so, but I think those two combinations, and then you start with a segment that seems to be either the easiest to deal with or the hardest to deal with. Maybe one bit of each, a pilot in each of the situations. As we talked about, different situations require different approaches and maybe even different regions. But I definitely think a combination of 1 and 2.
I'd like to build a little bit, because I think Henry got it exactly right in just articulating our three buckets. The only thing I would add is, if we are going to talk about bucket number 2, which I certainly favor, we have to recognize that it really represents 2 distinct programs. A program focused on serving the function the representative payee program currently serves, that relatively binary function. And it may be that is somewhat similar to number 1, some form of incremental reform, or perhaps, some more aggressive devolution, I don't know. But then also this question of the alternative to rep payee program, the supported decision-making approach in its more pure form. And that I think could only really be done through a devolved approach. I can't imagine that SSA staff could meaningfully manage that aside from providing the financing and the quality control and oversight.
So I'd like to suggest, I don't know whether this is the easiest one or the hardest one, and I have no idea of the numbers that are involved, so maybe I'm really off. But in the work that we've been doing now for almost 5 years on the ground in terms of actually doing supported decision-making as opposed to talking about supported decision-making, and we are among the very few people who have actually done that, we have found that the people with whom we are the most successful and have the best tools are transition age youth. And those transition age youth are already entitled to certain things from the education system. Not just free and adequate public education, a FAPE, which now has a little more content to it than it did before, but they're also entitled to transition planning, which is supposed to be moving them towards greater self-determination and community inclusion. That's what education is supposed to be doing for the people who they are serving who have intellectual and developmental disabilities. Now, I mean, I know the broad figure that the largest number of Social Security beneficiaries are minors, and then I assume that there is some transition when people become adults, and do they get into the system or they don't get into the system, and then if they get into the system, do they get into the system with rep payees or not? And if we're thinking about, looking at it from a somewhat human rights perspective, I don't think we're talking about an alternative system. We're just thinking about how do we keep people from having their rights taken away if they don't need to have their rights taken away, right? So there is an education system already there that's supposed to help people become self-determined and live inclusive lives. There are Medicaid funds, which we are using in New York under HCBS waivers, to actually pay for facilitation and supported decision-making for people who are getting self-directed services. And would it not be interesting to think about a pilot or, as a model of working with transition age youth, people who might be coming into or who are coming into the Social Security system as beneficiaries of SSI, and keeping them from becoming people who have rep payees by ensuring that in a capability determination, which I would say for starters, just as a totally low-hanging fruit, should absolutely include the right to have support in that capability determination, since we all make decisions with support. So deciding whether people can make decisions, they should be able to use support in that determination. And then just do it, find a place where a lot of 21-year-olds or whatever are getting rep payees, and then go in and start doing some kind of what we would call retail supported decision-making facilitation in some chosen schools. I mean, New York City is a great place because we have a giant school district just for people with developmental disabilities with, 100,000 people in it or something like that. So you could do it in some schools and not, and then see whether those people end up getting rep payees or not. And if they don't, then you've already developed a system based on existing resources that promotes human rights, that limits the number of people who need rep payees. And I guess rep payees cost the agency something. I can't believe that they don't. And then you have a model for a very large group of people and keeping them out of the system altogether, which is, just an analogy to what we're trying to do in terms of guardianship. If by the time people reach 18, which is the big entry point for guardianship for people with developmental disabilities, they have already been educated about how to make decisions, how to use support, where they need support, and they have a support system in place, that's the end of guardianship. So you may get rid of a lot of people who are coming in and needing rep payees just by using existing systems, but I think you need to demonstrate that those systems can work together and work for you.
Can I jump in?
Ben, please.
I don't know the answer to that question yet. And it seems to me that that sets the stage for some disciplined work by the Social Security Advisory Board to help frame it in real hard terms in the future. And also I would hope SSA in that process. You know, I should say I'm a kind of a former retired government executive, try to get done as much as you can get done in the right direction, given practicalities and pragmatism. So when I look at all three of these, it seems to me that the government-wide approach probably doesn't happen until SSA has moved the ball forward within its framework, which is the biggest in government, to the point that other agencies are saying, well, maybe we ought to be thinking about moving more collaboratively with what that agency is doing. So I think the third one says to me that it may be too big a bite of the apple as a first step. I think that there's tons to be argued in favor of the, as Henry described it, as the minimalist approach, which is still big, technology improvements, a stronger national policy framework so that various regions are managing this system within the same consistent framework, more training, et cetera. Those are all good things to do. They're consistent with GAO reports over years, Inspector General reports over the years. Those are all good things to do. But the second one, or somewhere between 1 and 2, to use Lou's framework, which I like, calls for more work, not just more pilots, but more work looking at what do we really mean by assessing the capacity of individuals? You know, what would that actually mean? 2, hard, and Henry talked about this earlier this morning, hard financial assessments as to what are the fiscal implications if we move in this directions? What are the, and that would be working with the agency, I would hope to try to get a handle on what that is. 3rd, some real hard work on human capital assessments, because from everything I heard this morning, we don't, you know, we may have some good creative ideas and some good creative practices, but they're small, and the idea of all of a sudden saying we're going to launch into something major, we're not there yet, doesn't seem to me. So some real hard human capital assessments, both externally to be able to do some of this, as well as internally within the agency. And then 4th, I think that what would be good in terms of the board looking forward is looking at some of the clear accountabilities for these various frameworks. Both accountabilities within Social Security, because it's still going to be within Social Security, the management, the oversight. When something goes wrong, it'll be SSA that will be testifying before the Congress. It's not going to be a bunch of individual little agencies. So what's the accountability structure that's set up within the agency to try to move forward? But also, what are the accountability structures that would be needed for the other entities that would be working? So it would seem to me that that kind of paints the picture of some future work. Some future work if the ball is really going to be moved. And it's work that I would love to see the board take the lead on.
Well, I'm always hesitant when somebody tells me that the answer to the problem is for you to do more work.
Absolutely.
But I do want to ask a related question, because sometimes you see a problem and you look in the wrong place for the answers. And so one thought that has come to me is that perhaps rather than asking Social Security to change or to rethink how it performs something, maybe there's a role for other agencies here. So analogy, in the guardianship area, I know on the local level out here in Oregon, agencies are working to try to rethink the role of guardianship within their service community. So for the IDD service community or the mental health service community or the senior service community, trying to work to encourage those systems, the people who work in those systems, the people who provide services and supports, to think about how those supports can be arranged in such a way to avoid the need for guardianship. And perhaps that work can, if that work is encouraged on the federal level, it could lessen someone calling up Social Security and saying this person needs a payee, for example. Are there other ways to get at the problem rather than changing the structure of Social Security?
Bob, I think that the guardianship is one aspect that needs to be drilled down on. What you do for a person who has a guardian may be quite different than what you do for the other population. So that's one aspect. I think what Ken has suggested is if you drill down on some of these issues, you would be practically putting together a menu of what it is you're trying to find for this contractor, whoever it is, to do. Yeah. And that's, would spell that out. And I think the best payee situation I ever saw in my 50 years of working with Social Security organizations was an outfit in Baltimore, Maryland, where the primary objective was a group of people, a group of representatives who represented persons applying for disability. It wasn't a lawyer group. It was a group of former caseworkers, basically. And they supplied all kinds of service to the individuals that came to them. Once the person received disability, they helped them get the other benefits that they might be entitled to from the state. They worked with them in the housing in all of those areas. And they had 50 homeless people that they were repayee for. And it wasn't a big operation, but they had persons on the staff who visited with the beneficiary in the nursing home, wherever they might be, found them on the street and talked to them, see how they were doing. They had a separate financial system to take care of the finances. You got to have both, but it's usually not the same person who can do both. So, I mean, I think there are different ways, but we need to spell out what it is we're looking for in this help. And I think that takes further work. And guardianship may be one area.
So I think that this is what I was trying to get at before in talking about an integrated approach, no matter where it fits, that a rep payee is not unto herself or himself, but is working with is first of all living himself or herself, and even if it's an organizational payee, in a context and in a community, and likewise for sure the beneficiary is. And so forming, if you will, a family of support around that individual is, regardless of the model, that ultimately everyone lands on, understanding who are all the players and how can they all work better together. And, I rattled some of them off before, but, here goes, again, guardianship for sure. There, and we heard about the ACUS work on sort of finding ways to overcome some of the barriers to sharing. And it sounds very promising, but even one-way sharing, if a judge in a court with jurisdiction over guardianship orders a report to Social Security on a bad acting guardian who may also be a rep payee, that's a part of the picture here. The ombudsman, again, for anyone who is residing in a congregate residential setting, the ombudsman is in there. The job of the ombudsman is to raise up the voice of those individuals. We've got legal advocates, including P&A, which most of you know a lot about, and also our legal assistance for older Americans, which, by the way, knows a lot about the Medicaid and Medicare rules, the SSI rules, and the SNAP rules that govern access to those benefits that wrap around the Social Security or SSI benefit, and can be very strong advocates for those individuals. Adult Protective Services, because when there are bad actors, Adult Protective Services hears about such people. And then there are all the community-based services and supports that are available beyond the big three of Medicare, Medicaid, and Social Security. So it really does require bringing all of that to bear. Again, no matter what model is used, to stop thinking of representative payees as unto themselves with only this little responsibility for a benefit. I was going to say check because that's how old I am, but a benefit payment that pops into someone's bank account every month.
Hillary, do those agencies that you, or the organizations that you just referred to, do they coordinate on any type of population right now?
Sure. I mean, there's lots of examples of that happening. But yes, now it's just like with any other program. It works better in some places than in other places. But we have lots of models of good working relationships, and we know that when that happens, for all the reasons that have been discussed all day today, that you end up with better outcomes and better quality of life for the individuals. And by the way, that quality of life involves potentiating their autonomy, interests in general. So yeah.
This is Erica, and I can't seem to turn on my video, so I'll just talk and assume that you can all hear me. But I'd like to reinforce what Hillary just said, because that's actually the vision that I see. But in terms of the three buckets and so on, I want to go back to something that came up in our report, and that's specialization. When we asked the managers about specialization, some of them were for it and some of them were not. And the ones that were more interested seemed to be in the larger offices. But it strikes me that a pilot, a specialization could bring us halfway, it could start bringing us from bucket 1 to bucket 2. Because if you start focusing just on those rep payee functions and making them better, you could gradually move into the kinds of relationships that Hillary is talking about on a pilot basis. So I see specialization as a 1.5 or something.
I would like to.
And I will say that, I'm sorry, Pam, I'm just going to make one more observation. I love your animals that jump all over you when you're on video. I just have to say that. That I like the idea, and again, I am not in a position to endorse one approach or another approach to this, or whether it should stay in Social Security or go somewhere else. I can't speak to that. What I can say is I very much like the idea of starting small and seeing if something works before launching some big national something or other, because it's just, well, for all of it, I see everyone shaking their heads, yes. So I won't go on. I just wanted to put that out there. Start small, see if things work. And if they do, then grow by increments.
So apropos of that, I'm just considering, I think it was Henry who said we have to decide if we're going to start in the hardest place or start in the easiest place. I think there's an interesting dynamic in which it may be the case that some of the most difficult, or at least perceived to be difficult populations, may be the administratively the simplest to pilot a supported decision-making approach to. And what I'm referring to here is, a lot of supported decision-making's roots come in the world of intellectual and developmental disability. And I think there is an infrastructure, in particular a provider infrastructure, that can be leveraged in IDD, you know, in a way that could conceivably be very useful if we are thinking about that sort of ticket model of SSA financing for locally delivered services. So excuse me, sorry. I just raised that because I think when we talk about, you know, starting easy or starting hard, you know, there would be a school of thought that would say, well, starting with people with cognitive disabilities, starting with people with complex support needs is starting with a difficult population. But in fact, because that's a population that has a significant provider network that's in their lives and that actually often has some expertise in facilitating decision-making support in a less binary fashion, depends on the provider, depends on the state, et cetera, but some expertise, you know, I think there's a case that some of those you know, higher need populations may actually be a better starting place for a supported decision-making pilot for SSA.
So I'd like to, I'm going to jump in here and say that first, Lou, I was breathless that you weren't going to go straight to bucket 2 and not say that they were that they had to be mutually exclusive. So I'm so glad that you said that. And I, of course, agree a lot with Hillary and Erica because I always agree a lot with Hillary and Erica. But I want to go back to David Lesperini, who's somewhere down in the bottom of my screen, who said, we need to have the documentation that we use to be uniform. And I'm a low-hanging fruit starter person. So it seems to me none of this is mutually exclusive. If you could make the questions that you're asking include certain issues or concepts of supported decision making, then you already have fought a battle, and it hasn't been hard. There will be hard battles to fight. But if you could even have the questions embedded that they ask when they make decisions, put some of this in those questions, would that be huge? Because you would be addressing better who should be represented payee and who needs them. So I would start at that one place, and then I would move on to making some of to the pilot that you have. And may I also say, in that pilot, because of the research where he says this, measure it thoroughly about the outcomes you want. Don't just do it. Measure it for the outcomes you want against the things you embedded in the questions you asked, the decision that got made, the results that happened because of it.
I want to question. I'm talking about some of the things Hillary said. Oh, I'm sorry, Bob.
No, please.
I think that where do we start? I think the starting point, specialization is a great idea, perhaps. And it may be in one office or another office. It may be at the regional level. It may be somewhere. But we have to start by having SSA grasp this idea and develop that leadership specialization in SSA. If they're going to specialize, how are they going to decide to specialize? What in? There's no one there, as far as I know, who has the responsibility for looking at this. And they need somebody who has some understanding of what we're talking about here, involved in developing the SSA program. Ken said it, hopefully SSA is going to be involved in moving this along. Somebody there has to, that's where it starts, getting somebody there. And then specialization has been used and trashed by SSA for different reasons at different times, because small offices can't afford to specialize. There's all kinds of issues that go with that. On the other hand, maybe it's at an area level or at a regional level or whatever level, but somebody has to be the focal point at SSA, and I think that's a first step, getting that recognition.
I have a question. I have a question from a participant. Just wanted to throw it out to you. And this really comes into the category of are we going down a road that might be overly intrusive and perhaps paternalistic, or if there's a gender neutral term for paternalism. And it is that, I'll read it to you. It says, I'm not sure that we want rep payees moving beyond the scope of managing monthly cash assistance. How far should they be going into other aspects of a person's life?
I didn't think any of this was going beyond the rep payee. As a matter of fact, I thought we were trying to get some people freed up from having a rep payee by helping them, by supporting them. Maybe I'm missing something, but.
Yeah, I mean, I feel the same way, and I'm sorry, but Ari, that was a New York thing to jump in like that. I apologize.
Okay.
And I'm not even in New York, but that's where I grew up. It's not so much that they would take on more things, because whatever the gender neutral term is for paternalistic, that there would be some high risk there. And we do want fewer people to have. Obviously, we want more people to be making their own decisions. It's a question of understanding a web of relationships and having respect for the context in which an individual lives. So having the respect for what somebody is doing and just understanding that there's a whole network there, and in all of us are surrounded by community in some way, shape, or other. So that's what I'm suggesting, not that rep payees start taking over more and more roles in an individual's life, but that they understand that they are a part of a context of an individual's life.
So I agree with that, but I think it raises a very interesting point, because I think Commissioner Anoff is absolutely right that the name of the game with supported decision making, at least as I see it, is to keep people out of the rep payee program and offer them an alternative. And that raises a question, right? Because I think there is going to be a significant problem if you rely on the same entities to provide supported decision-making services as you are relying on to provide representative payee services. There's a problem in terms of culture. If you have an organization whose, historic workflows, training, mission has been oriented around substituted decision making, they are not going to easily transition to a supported decision making framework. And there's also a problem in that if we think about what supported decision making is, at its core, it has to include the possibility that the supporter recommends something and the individual being supported says, no, I don't want that. I don't agree. You may think it's the wisest, most obvious choice in the world, but I decline, or I'm going to do it anyway, or what have you. And I think there is a risk that if the supporter has the authority by virtue of a formal mechanism or just by virtue of institutional knowledge of the rep payee program and the substituted decision-making pathway. If the supporter has the authority to shift an individual from supported decision-making into substituted decision-making and still maintain their reimbursement from SSA and really be held harmless by virtue of that transition, that's going to corrupt the extent to which supporters will respect a no, I won't take your advice from the people they're supporting.
I'd like to just step in for a second, because I'm having a little trouble in some senses understanding what I'm doing here. I thought that my purpose was to make people focus on the beneficiaries, and Ari, you're doing that now, and I'm not criticizing other people, but when we talk about supported decision making, it seems to me that there are within Social Security and Rep Payee, there are three buckets. One is keeping people from even being reported as potential folks who need to have Rep Payees appointed for them. I mean, there's nothing magic about how it happens. Somebody has to call somebody up or send in a note saying this person can't manage their money, right? It doesn't just kind of happen out of the sky. So how do we keep that from happening? That's where I would say working with the schools, getting people, already to have systems in place so that their parents or some kindly service provider or whatever doesn't just look and say, here's a person with a developmental disability, just like we tell their parents they should get guardians. At 18, we tell them that they should become the Rep Payee. That's what's being told to parents. So if you set up a system where that's no longer the expectation, where the hard wiring that the way you protect your child is to become a guardian, that the way you protect your child is to become the Rep Payee, that's step one. That I think you do kind of by trying to maybe doing a pilot or whatever with the ed system and trying to talk about how that gets built in there. Because as I say, they're already paid to do transition planning. So just let them do good transition planning instead of crappy transition planning. Then there's okay, now somebody's been recommended. How do we keep people who shouldn't have Rep Payees, who should have their autonomy, who we want to have their autonomy and their self-direction, from getting Rep Payees as opposed to being able to make their own decisions? So part of that is about the capability determination process. I think it's absolutely critical that you get away from medical diagnoses, which have been sort of the underlying assumption for guardianship and people having capacity. And we're past the medical model. We're in a functional model where, disability is a social model. It's not a medical model anymore. And certainly the Social Security Administration should not be operating on a totally medical model when nobody else is. So in that situation, yes, Morgan is absolutely right. People have to be heard. There has to be, some modicum of due process, but also we have to recognize, if we're talking about supported decision-making, that people are entitled to support in the determination of whether they have the capability of managing their money. And the question is, can you manage money with the supports that you have chosen and the system you have set up, as opposed to a system that we set up for you where we give somebody the rights? And then the third bucket is people who are already in the Rep Payee program who maybe shouldn't be there or whose capability has increased and who want to get out. And each of those has different solutions, and each of those, when we talk about supported decision-making, which I keep hearing it being said, but I don't really know what anybody means by it, plays a different function in each of those spaces. And I think that, you could address any of them. I think it would be pretty easy on the micro level to do something about the capability determination and make it better. Like it couldn't be worse. So you could certainly make it better through any of the things that Pam and Erica have suggested, and through the suggestion that there should be support for the person in that determination. But you can think about the other two as well, and in each one, it's about what would supported decision-making do for the beneficiary to enhance their self-determination and get rid of substituted decision-making, which takes away their personhood and their dignity. I mean, I think we're getting away from that question. And look, you're administrators, you have a huge system, you have billions of dollars that you have to think about, and I get all that, but let's not lose those people and how we actually affect those people.
I have another question before I get back to buckets, because I was thinking of some other buckets, but here's another question from a participant, which I think is really interesting. And it gets to back to the confidentiality kind of issues we were talking about earlier. The question is that the participant thinks that SSA needs to address issues around supporters trying to speak to the agency, investigating, get information about benefits, and told that they need to become a payee in order to have that level of interaction with the agency. Is this an area where we can encourage people to participate in lives and decisions of other people without pushing them into becoming payees in order to do so?
I'd like to weigh in on this, if that's okay, because this happens to me all the time, I think, in my direct advocacy. apart from the national work I do. It happens all the time. People say, oh, well, in order to talk, supporters face this in a variety of settings. And this is an example of a financial setting where they say, I can't release information to you because you're not a substitute decision maker. In this case, a representative payee. It happens in the healthcare context. I can't release information to you because of HIPAA. And it's very easily accomplished through Social Security's consent for release of information form, just as it's easily accomplished through a HIPAA release form if you're in the healthcare context. And I think that really requires a lot of education on the part of, who's ever answering in the incorrect way to say that you actually need to be a substitute decision maker in order to support someone, because you don't. It's very easily accomplished. Someone can knowingly and voluntarily, the beneficiary can knowingly and voluntarily execute a document that allows the release of that kind of confidential information. And it's these kinds of pieces, I view it almost as it's lower hanging fruit to be able to educate people about the forms Social Security already has. And then to take the forms that it does has, just to go back to Judge Glenn's point, looking at the medical form for that doctors fill out for, there could be improvements that are made to that form to recognize it's not about judging someone's capacity in a vacuum, because no one's capacity should be judged that way. We all use support of our networks. And so it's about phrasing those kinds of questions differently and also demanding a higher level of actual response on the part of the doc or part of whoever the quote unquote expert is, to not just say the diagnosis and think that does it. You don't just say Down syndrome. You don't just say dementia. You actually have to explain and use the form in a proper way. And so I think those are some of the pieces that can get over some of the hurdles to recognition of supported decision-making and also diversion from representative payee program using supported decision-making.
I'll just note that in the guardianship context, I've seen doctors' notes supporting a guardianship petition in which the doctor says, this person needs a guardian, period.
I have as well. I've seen that too many times.
Likewise, in my former lifetime as a legal aid lawyer, absolutely. And I just want to just really amplify what Morgan said. The way we characterize this is consent is golden, and that should really overcome most of those perceived barriers. So Morgan, I couldn't agree more. It's such low-hanging fruit, and it involves the individual in the decision-making process to do that.
I have another bucket question, which is if we were to approach a pilot project, would we want to segregate out who we're focusing on between the type of rep payee, the individual rep payee, the organizational rep payee, the institutional rep payee? Because it seems to me that they would pose different issues.
Absolutely. You have to segment in that manner, as well as some other issues that cause things to differ. You have the person who has a relative versus a non-relative, a person who's living out, not living with the person, the homeless person. You have to look at all of those in an individual way. I mean, they're all different. And if I could respond to something Judge Glenn suggested, a youth transition project, and I think it's an excellent idea, but that begs the question of, we didn't look at childhood issues here. These were all dealing with adults. The area of payees for those under 18 has significant problems. I know that the majority of cases are parents with custody, and those are 80% maybe okay, but for foster kids, there's a disaster. For a number of children whose parents allegedly have custody, particularly when you're dealing with persons with addictions, those kids really are not in their custody. Grandma and grandpa have them, and the money's being used for purposes other than which it's supposed to be used for. So there are areas in the childhood area, and I would suggest, if I can suggest some more work for you, Bob, I think the board could take the next step of looking at childhood, because you've made a very good, beginning here with the adults, and childhood really begs to be improved for that group of people. It's a smaller number, but it's a very difficult problem.
Judge Glenn, you weren't just talking about childhood though, correct?
No, I wasn't talking about childhood. I was
right. You were talking about the transition to adulthood.
Right, exactly.
And how people get special education services even after they turn 18 and enter into adulthood, and how to actually think more kind of holistically about how to provide supported decision making through a pilot by using those different kinds of approaches.
And then seeing if those people who have disabilities who will be entitled to SSI or whatever no longer are targeted for rep payees, or somebody requests rep payees or whatever, as opposed to those who do not get supported decision making. I would guess yes, because what we see on the ground is that when people actually go through our facilitation process, the parents' whole orientation towards their relationship towards their child and their child's way of being in the world changes, so that, I'm guessing that it's parents mostly who say, my child doesn't have the ability to manage his own money, needs a rep payee, I should be the rep payee. I don't know this, so maybe I'm just shooting in the dark and I'm completely wrong. But if that's what's happening, then setting up systems in which parents are not going to do that and respect their child's ability to make their adult child's ability to make their own decisions with supports, just cuts out a bunch of people who then don't have to have rep payees at all. But I'm talking about folks 18 and over who get rep payees, and how you can cut that off at the whatever the metaphor is, by providing supported decision-making services, and not SSA doing that, but SSA persuading somebody in DOE to try it and see if it works. And then if it saves money and doesn't cost them any more money and it saves you money, then isn't that a good thing? Plus, it furthers the human rights of the people who now are not subjected to a substituted decision-making regime.
I think it's a good group of people, but when I used the term childhood, I wasn't talking about childhood disability benefits per se. I was talking about those persons who turn 18, because there's a whole set of other issues that get involved in making the decision on rep payee for children when they transition. But I think it's a good suggestion, but there are different issues.
Just to briefly jump in there, first, I wouldn't totally rule out the possibility of SSA financing. I mean, I think if the program is designed to divert people from rep payee status, it makes more sense for SSA to provide the financing than ED, but that's another relatively small matter. The bigger matter is I'm very intrigued by the opportunities to also look at employment outcomes with respect to any pilot or demonstration associated with supported decision making. And if you are randomizing, the intervention, it would not surprise me if those who are diverted from rep payee status and instead experience supported decision making over, years of 18 through 25 or what have you, or 18 through 22, 22 to 23, whatever age range you talk about, see better employment outcomes than the control group that does end up disproportionately going into rep payee status. In the work that I've done on supported employment policy, one of the things that we've seen come up is that often families who are serving as the rep payee are making use of the SSI check as part of the sort of the larger family income. And that's not always inappropriate, right? I mean, if the SSI check is going towards rent, a quote unquote adult child lives there too, sometimes it's inappropriate. But independent of that, it effectively creates a situation where there's a disincentive or the family to support the individual with a disability to enter the workforce. Even though in the aggregate, the earnings will be greater than the loss, than the loss in SSI benefits. The SSI benefits were going to the representative payee, and the earnings, at least at some level, are going to the individual. So I just would really encourage whoever ends up designing the evaluation for a pilot or demonstration of this nature to include some degree of randomization so that we can look at a control group in a meaningful way, and B, to look at employment outcomes along with whatever other outcomes we may want to look at.
Another question that leaps to mind, and I know we're getting near the end here, and you've been very generous with your time, but it seems to me that the conditions on the ground, particularly for organizational payees, is a situation where SSA can have trouble finding someone or some entity to play that role. And so, the beggars can't be choosers situation where there's pressure to find someone. And that of course can result in bad choices by SSA. My question is that a pressure that needs to be addressed in order for us to be successful in having a more individualized approach to the REP payee program?
I think the answer is of course. I mean, that's going to be one of the core operational issues for a pilot or for any one of these things. I'd love to hear from Chris and David at the field office level about if something like this were generated in an area, what are some of the questions, challenges, and opportunities that they think something like this might produce. So I think hearing from them would be really helpful, I think.
Thanks. Go ahead.
I was just going to say, thinking about Pam and Erica's, thinking about Pam and Erica's research, it would, if you went to, some field offices and you looked at the beneficiaries whose rep payees are these private institutions, wouldn't it be interesting to actually see whether those people actually need rep payees, or whether there would be something that could be done for those people that would get them out of the rep payee status, and what that would cost? I mean, I assume you have no idea about that. And again, that's because it's not your job to look at the beneficiaries and their well-being, but there may be a direct connection between the well-being, the ability to make decisions and use supported decision-making, to make your own decisions about money, to get out of rep payee status, that would relate directly to way too many people being in these basically for-profit operations. Because I'm sure that the for-profit operations have real incentives to keep people in them. I mean, I can't imagine that they're helping people develop their self-determination and encouraging them to apply for jailbreak, right? So.
Erica?
Sorry, Erica?
Oh, it wasn't me.
Oh, okay. Sorry. Please proceed.
To Judge Glenn's point, I think I can't speak I haven't done the data nationally, but looking at the microcosm of DC, there was a practice for everybody receiving intellectual and developmental disability public services to have the Department of Disability Services become your representative payee. And so that DDS could collect its cost of care for you. And so there wasn't a really in-depth discussion of what people were assumed to not have the capabilities simply because of a diagnosis. And that started to shift, but it's been a very slow kind of shift. And it shifted to service providers becoming people's representative payees, who also have certain kinds of financial incentives, who also are assisting in managing of accounts, et cetera. So I think the question you raised, Judge Glenn, is a very important one.
So Kim, I think we're coming up at the end of our time now. Can I shift it to you?
You can.
Great.
You can. So we have covered so much.
Could I just say one last little thing?
Sure.
Sure, go right ahead, Ken.
And I don't want to cut you off, but I know you're getting near the end, but I think Henry Aaron has moved the ball here quite a bit over the last few years. And I just hope as we try to think about what the next steps are going to be, that we think about ways to be able to keep Henry Aaron involved in these things, because he's moved the ball. And I just wanted to make that plug. That's all.
Thank you very much, Ken. We'll
Great.
talk to Henry in just a second. As I said, we have certainly covered a great deal of ground today. And so, first of all, I just want to thank everyone for all of your contributions today. We've had some back and forth a little bit on the Q&A. So, Claire, I'm just going to trust that you and the staff will get back to people with answers to their questions if they haven't been answered, so we can kind of close that loop so people can be responded to. I'll leave that in your capable hands. I certainly want to thank, again, Pam, Laura, and Erica for their extensive research that shined a bright light on what's happening on the ground and the challenges Social Security employees face every day trying to make the right decisions regarding representative payees. These sound recommendations should be carefully considered by Social Security to improve the representative payee program, and certainly be considered as a launching point. And we certainly discussed their recommendations for research and a lot of others. I certainly also want to thank our moderators for keeping us on track, and to the staff for your technical support. We clearly there's a lot of work to do for sure. I think it's important that we also keep in mind that Social Security is right in the midst of a massive challenge in terms of trying to effectively deliver services during this pandemic. Having said that, I think all of us probably also realize that on the other side of this, service may not exactly look the same. And that could really create an opportunity for a lot of the ideas we discussed today. So I'm going to remain hopeful. Your insights and recommendations will assist the board more than you know as we determine the board's next steps. And I know our staff will be in touch to further develop many of the ideas and suggestions we heard today. And this will absolutely be another beginning, I should say, because we've been around the turnip patch on rep payees for quite some time. As we close today's forum, I do have one last special acknowledgement I'd like to make. At the end of September, which is next week, Henry Aaron's 6-year term on the board will end. When Henry first joined the board, he was not even familiar with the representative payee program. And since then, not only has he been committed to further understanding the program, he's been instrumental in the board's focus on representative payee work and all the projects that we have completed to that end, among so many other projects. And Ken, I thank you so much for your rallying cry behind Henry, as I hope that he will continue to help us as we continue to work forward and move forward on this on the representative pay program. Henry is committed to raising awareness, demanding action, and pursuing solutions. And as this is Henry's last public appearance, I want to thank Henry for his outstanding service to our nation and let him know how much he will be missed. The board will also be having some further thoughts for Henry tomorrow as he gets ready to leave the board. So again, thank you all very, very much. We plan to keep in touch. We can't thank you enough for all of your great suggestions, and we wish you a great day.
Thank you.
Thank you, Kim.
Sure.
Thank you very much. Great day.
Thank you.
Thank you all.
Thank